Good morning, everybody. We are here today on docket number 24-32717-CON, Northwell HS, Inc., and Nuvance Health. The applicants in this matter seek a certificate of need for the transfer of ownership of a healthcare facility pursuant to Connecticut General Statutes, Section 19A-638, Sub A, Sub 2, and transfer of a group practice pursuant to Connecticut General Statutes, Section 19A-638, Sub A, Sub 3. Specifically, they seek to transfer Nuvance's New York and Connecticut hospitals to Northwell through an affiliation. Of specific interest to OHS are the three hospitals in Connecticut. Those are Norwalk Hospital, Danbury Hospital, and its New Milford campus, as well as Sharon Hospital, as well as Nuvance, Connecticut, their medical foundation, Nuvance Health Medical Practice, CT, which is frequently known as Western Connecticut Medical Group, Inc. The applicants have indicated that there is no capital expenditure associated with these transactions. Today is November 6, 2024. My name is Daniel Chuka. I am a staff attorney with the Office of Health Strategy. To my side is the commissioner. Although I am here to assist and provide legal counsel, the commissioner will be presiding over this matter. She will rule on all motions, and she will issue a decision that includes findings of fact and conclusions of law upon completion of the hearing. At this time, I will invite her to introduce herself. She also has prepared some opening remarks that she would like to share.
Thank you, Dan, and good morning, everyone. We're also joined by Boyd Jackson, our Director of Legislation and Regulation at the Office of Health Strategy. Welcome, everyone. As you heard, I'm Deidre Gifford. I wanted to say a few words before we begin the hearing about the purpose of our questions today and the requirements that are imposed on the Office of Health Strategy when we are evaluating the transfer of ownership of a hospital. Connecticut law directs the office to evaluate a number of criteria when deciding whether to approve any certificate of need. These criteria include whether there is a clear public need for the proposal, whether the applicant has demonstrated that the proposal will improve quality, accessibility, and cost effectiveness of healthcare delivery in the region, the impact on existing healthcare facilities, the impact on provider choice, and the impact of any consolidation of ownership on cost and quality. It's the responsibility of the applicants to provide the data to OHS to adequately evaluate these criteria, and today's hearing is part of the process for the applicants to present such evidence. When the certificate of need involves the transfer of ownership of a hospital, as this one does, there are additional statutory criteria that apply. These include whether the applicant fairly considered alternative proposals or offers, whether the applicant demonstrates how healthcare services will be provided by the new hospital in the first 3 years following the transfer of ownership of the hospital, including any consolidation, reduction, elimination, or expansion of existing services or introduction of new services. The law also describes the standards that OHS is to use when approving a transfer of ownership. And I'm quoting here from the statute. The unit shall deny any certificate of need application involving a transfer of ownership of a hospital unless the executive director, now commissioner, finds that the affected community will be assured of continued access to high quality and affordable health care after accounting for any proposed change impacting hospital staffing. The unit may also deny any certificate of need application involving a transfer of ownership of a hospital subject to a cost and market impact review if the executive director commissioner finds that the affected community will not be assured of continued access to high quality and affordable health care, or finds any likely increases in the prices for healthcare services or total healthcare spending in the state that may negatively impact the affordability of care. Under certain circumstances, OHS must also produce a cost and market impact review to study the likely impacts of the transaction on market consolidation and price. This transaction is subject to such a review, which is being performed by an independent third party and which will be evaluated by the office for potential referral to the Office of the Attorney General per statute. So during today's hearing, OHS will continue to supplement the written record provided in order to evaluate these criteria. I want to thank the applicants for their engagement in the process so far, and we look forward to hearing the evidence to be presented. Thank you.
Thank you, Dr. Gifford. This is a hybrid hearing. By that, I mean it is being held both in person and electronically via Zoom. In accordance with section 1-225A of the Connecticut General Statutes, any person who is participating orally via the electronic component of the meeting shall make a good faith effort to state his, her, or their name and title at the outset of each occasion that such person participates orally during an uninterrupted dialogue or series of questions and answers. If you're present in the room, you don't need to do that, although it would be helpful to the court reporter. Sign up for public comment will be from now until 1 p.m. There have been a number of people who've been signed up prior to the hearing as well. If you would like to supply commentary, please sign up either in person or in the Zoom chat box at the designated time, which is now. You can also submit written comments to concomment@ct.gov for up to 7 days from the final date of the hearing, whether it be today or November 13th, 2024. Please note that unlike with many other hearings our agency has conducted, the time set for the commencement of public comment, 1 p.m., is not advisory in this case. In order to ensure as uncomplicated and efficient a hearing as possible, we will begin public comment at that time, even if the technical portion has not been completed. For anyone attending remotely, unless you are actively participating in the hearing, either as one of the applicants or interveners witnesses, or as a member of the public providing comment at the designated time, please mute the device that you are using to access the hearing and silence any additional devices that are around you. This public hearing is held pursuant to Connecticut General Statutes, section 19A-639A, sub F, sub 1. As such, this matter constitutes a contested case under the Uniform Administrative Procedure Act and will be conducted in accordance therewith, along with the regulations of Connecticut state agencies beginning at section 19A-9-24. As Dr. Gifford just mentioned, also to our side is Boyd Jackson, who is the Director of Legislation and Regulation. Mr. Jackson and I will likely be asking the bulk of OHS questions, with additional questioning to be supplied by the Commissioner and perhaps the assigned CON analysts as well. The CON analysts are in a overflow room because we weren't sure how many people we were going to have here, but they may make an appearance later on. The assigned analysts are Annalise Fiala and Nicole Tomczyk. CON manager Stephen Lazarus is attending remotely. Also present is Faye Fentis, who is another OHS staff member that is assisting with hearing logistics, the gathering of names for public comment, and providing other support. Their certificate of need process is a regulatory process, and as such, the highest level of respect will be accorded to the applicant, the interveners, members of the public, and our staff. Our priority is the integrity and transparency of this process. Accordingly, decorum must be maintained by all present during these proceedings. I'm going to make some comments now that I don't typically include in the preliminary statements that I make at these hearings. This is going to deal with the topic of confidentiality. This hearing is being transcribed and recorded, and the video will also be made available on the OHS website and its YouTube account. However, for anyone familiar with the docket, if you have likely noticed that there have been a series of confidential filings. There's a good chance that we will need to go into executive session to discuss some of these filings or topics that they concern, and anything that takes place in executive session, although recorded and transcribed, will not be made publicly available. For the benefit of the public, I wanted to talk a little bit more about what the agency has determined will be afforded this confidential treatment. OHS has developed processes and procedures related to the handling of certain private information. Broadly speaking, the documents set aside in this matter meet one or more of the FOIA exemption criteria set forth in Connecticut General Statutes, section 1-210B. This means that although the documents are considered public records, they cannot be accessed through the usual FOIA process. Some of the documents were jointly filed, while others were filed separately by each of the applicants, since antitrust laws prevent the other from seeing certain information prior to the transaction being consummated. The most common FOIA exemptions are the following. Sub 2, which deals with personnel files where there would be an invasion of personal privacy. Sub 5, big A, which deals with trade secrets. Sub 5, big B, which deals with commercial and financial information given in confidence, which is not required by statute. These together are considered sort of the anti-competitive FOIA exemptions. Sub 9 deals with documents regarding collective bargaining. And sub 10 has two parts, records and tax returns exempted by federal law or the general statutes, as well as attorney-client privilege documents and attorney work product. Some of our questions may rely on these documents. Other questions may not rely on a specific confidential document, but will still deal with information that is confidential in nature. And still other questions may seem completely public, but the parties or their attorneys have determined that the responses may elicit sensitive information. In all of these cases, the questions will be asked and answered in executive session. Prior today, we sent each of the applicants two different links, one for joint confidential information and the other for party-specific confidential information. Although we will do our very best to handle all executive session matters at once, there may be a need for some bouncing around and some flexibility. We appreciate the public sensitivity to this and apologize in advance if it causes any confusion or annoyance. As Dr. Gifford mentioned earlier, she will consider and make written findings in accordance with section 19A-639 of the Connecticut General Statutes. And lastly, I wish to point out that by appearing on camera in this hybrid hearing, you are consenting to being filmed. If you wish to revoke your consent, please do so at this time by either exiting the Zoom meeting or this hearing room. Okay. I'm going to start by going over the exhibits and the items of which we are taking administrative notice. And then I'll ask if there are any objections. All non-confidential documents related to this hearing that have been or will be submitted to OHS are available for review through the Certificate of Need portal, which is accessible on the OHS CON webpage. The CON portal contains the pre-hearing table of record in this case. At the time of its filing 2 days ago, exhibits were identified in the table from A to WW. Afterwards, we had some additional filings. One is a support letter from Representative Maria Horn, which has been identified in the docket as Exhibit XX. We also received the PowerPoint presentation that Northwell intends to show this morning, which we are identifying as Exhibit YY. And last night, we received a bench brief from the applicants, which we are identifying as Exhibit ZZ. Counsel for the applicants, can you please identify yourself for the record, beginning first with Northwell and then turning to Nuvance?
Yes. Good morning. Good morning. This is Michelle Volpe, Michelle with 1L, V as in Victor, OLPE. I'm here on behalf of the applicants in this proceeding, joined by Ben Jensen. Thank you for allowing us to be here today. Dr. Gifford, Attorney Jackson, Attorney Suka.
Thank you. Attorney Jensen, I thought I saw Connor here too. Oh, yeah. Also present is Connor Duffy and Lisa Boyle for Nuvance. Today, we also have the interveners who have been granted limited status in the proceeding. The interveners are Save Sharon Hospital, Dr. Howard Mortman, and Dr. David Kurish. Counsel for the interveners, can you please identify yourself for the record?
Good morning. My name is Paul Canag. I'm with Murtha Kalina,
Thank you.
and I represent the interveners.
Thank you. So attorneys for the applicants, do you have any objections to the exhibits that I listed earlier? That would be A through ZZ.
No objections.
Thank you.
I have one question. You referenced in that you just received something called a bench brief.
Correct. That has been uploaded to the portal.
Okay. You're going to give me a copy?
Yeah, we have that for you, Paul.
So all identified and marked exhibits are entered as full exhibits. Attorney Volpe, do you have any additional exhibits you wish to enter at this time?
Not at this time.
And Attorney Jensen, how about you?
No additional exhibits.
Thanks. Just a reminder, you need to hit the button in order to be heard.
No additional exhibits.
Okay, thank you. The parties are hereby advised that we are taking administrative notice of the following: the statewide healthcare facilities and services plan and its supplements, including the 2024 version, the facilities and services inventory, the OHS acute care hospital discharge database, the all payer claims database claims data, hospital reporting system, that is HRS, financial and utilization data, community health needs assessments for the hospitals at issue, and the RAND hospital price transparency study. We are also taking administrative notice of docket number 18-32238-CON, which the applicants have referenced at various times in their submissions. That's the CON docket pursuant to which Nuvance Health was established through the affiliation of Western Connecticut Health Network and HealthQuest Systems. Attorneys Volpe and Jensen, are there any objections to the administratively noticed documents and dockets?
Yes, applicants do have an objection that we'd like noted for the record on the all payer claims data. We'd like an opportunity, a corresponding opportunity, to be privy to specifically what within that filing and database that OHS will be relying on to issue its opinion. While Connecticut General Statutes 41786 permits you to take administrative notice of the all payer claims data, this same statute affords applicants under subsection 7 of the statute to be notified in a timely manner that affords us an opportunity to know specifically what information and facts and data you're going to be relying on as part of your decision. And during this administrative proceeding, just providing administrative notice doesn't afford us with the time and specific information that you may be relying on, which may be prejudicial to the applicants. So applicants' preference is to work collaboratively with OHS on the data under the APCD that you'll be relying on for purposes of issuing your decision, and perhaps to dispense with our objection this morning. You'll indulge us and allow us to submit a motion to help understand our respective rights with that administrative notice that will allow us to take some closure of our objection today and allow us to preserve our procedural rights consistent with the statute. So we ask that you respectfully allow us to submit a motion in furtherance of our objection. Sure, of course.
We're going to give you the opportunity to do that. And to the extent that we do rely on APCD data, We will provide any excerpt to you so that you have an opportunity to respond as well.
Thank you. Appreciate that. Thank you.
To date, we haven't done that, so we can't give you an opportunity to respond right now because we haven't,
Determined.
provided the excerpt at this point. And I don't know if an excerpt will be produced. It depends on what the commissioner determines is necessary for the evaluation of the criteria.
We understand. So we just wanted to be on record of objecting. Appreciate your indulgence in allowing us to file a motion to address.
No problem. Attorney Jensen, can I assume you echo the same objection?
Correct.
Okay.
Nuvance Health joins in the objection. There's no other objections to the administrative notice items.
Okay.
Thank you.
Thank you. As the hearing progresses, we may also take administrative notice of other information, including prior OHS decisions, agreed settlements, and determinations that may be relevant, but which have not yet been identified. Again, we will provide you with notice and an opportunity to respond to any of those as well. So with all of that, we're going to proceed in the order established in the agenda for today's hearing. After I log back into my computer. I would like to advise the parties that we may ask questions related to your pre-hearing submissions that you feel you have already addressed. We will do this for the purpose of ensuring that the public has knowledge about your proposal and for the purpose of clarification. I want to reassure you that we have reviewed the docket and will do so again before issuing the decision. As this hearing is being held in hybrid fashion, we ask that all participants attending via Zoom enable the use of video cameras when testifying or commenting remotely during the proceedings. All participants in the public shall mute their devices and should disable their cameras when we go off the record or take a break. Please be advised that although we will try to shut off the hearing recording during breaks, it may continue. If the technology continues to run within this room, any video and audio that has not been disabled will be accessible to all participants. There are special considerations there with respect to executive session that we'll be mindful of as well. Public comment taken during the hearing will likely go in the order established by OHS during the registration process. However, we will allow public officials and clinical professionals to testify out of order. Registration for public comment, as I mentioned, has already begun. As I stated earlier, public comment will begin at 1 p.m. even if the technical portion of the hearing has not concluded. The applicants and the interveners' witnesses must be available after public comment, as OHS may have additional follow-up questions based on the public comment. Attorney Volpe and Attorney Jensen, are there any other housekeeping matters or procedural issues you would like to address before we start?
Just briefly, Attorney Chuka, for when the witness is here, I believe I may have just gotten my answer. My question was if we needed to pivot to be in front of the camera at all, but I take it Attorney Jackson is on the camera. So thank you very much.
Attorney Knogg, did you have any housekeeping matters you wanted to address?
No,
Okay.
not at this time. We're still waiting for Dr. Courage, so we may have to address that later. I don't know what's happened until later.
Okay, thank you. So there are two applicants in this matter, so we will leave it up to them to guide us on how they would like to open the technical portion of the hearing. I do think it would make sense to have all the witnesses who plan to make remarks identified, and then I can swear them in. But beyond that, we're flexible. So attorneys Volpe and Attorney Volpe and Attorney Jensen, you can proceed with however you'd prefer.
Okay. Yes, we do have a specific order for the technical portion of today's proceeding on behalf of the applicants. And do you want to swear in witnesses now, or would you like us to proceed? What's your pleasure?
I think it would make sense to swear everybody in for both applicants. And then we won't have to do it again until we get to the intervener.
Those who offered pre-file testimony are here to be sworn in. We also have some other subject matter experts in the room to the extent we need them. You know, perhaps they can get sworn in at that time, but we don't anticipate requiring that. So,
So I will just have each of them identify themselves by
Perfect.
their name, spelling of their last name, and title them.
yes, we'll start with Dr. Silver.
Good morning, Peter Silver, Silver, Chief Quality Officer from Northwell.
Michael Dowling, President and CEO of Northwell, that's Dowling.
Morning, Mark Solazzo, Solazzo, President Strategic Initiatives and Chief Operating Officer, Northwell.
John Murphy, Murphy, President and CEO of Nuvance Health.
My name is Dan DeBarba, DEBARBA, and I'm the Chief Financial Officer of Nuvance Health.
Thank you. Can you please all raise your right hand? Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you have provided in your pre-filed testimony and the evidence that you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God or upon penalty of perjury? That the record reflect that each witness answered in the affirmative. So the applicants and their witnesses can now proceed. When giving your testimony, make sure that you adopt your written testimony.
Thank you, Attorney Chuka. Again, for the record, my name is Michelle Volpe, and I'm here today with Attorney Ben Jensen, and we're serving as legal counsel for the applicants in this proceeding. We appreciate the opportunity to appear before you today. We want to start by formally recognizing on the record the efficient and collaborative process that has been conducted by the Office of Health Strategy. While I've been before this agency for 30 years, this is Northwell's introduction to the Connecticut regulatory process. And we want to know on record how appreciative and how collaborative this process and this specific application has been, the expeditious manner in which the application has gone through your office. And we want to publicly note all of the time and attention that Dr. Gifford has provided and how collaborative Chuka and Attorney Jackson have been to both applicants in this matter. You've provided unlimited access and it's very appreciative. And I think it's allowed this proceeding in our application through your agency with a lot of transparency, and we're very grateful for that. And it's been from the inception of when we announced the affiliation till today. So thank you. We also thank you for the new OHS confidentiality policy that was issued at the start of this year, and allowing us to submit and afford treatment of confidentiality to some of our submissions. As you've recognized, the applicants, Northwell and Nuvance, are entitled to protection under, where appropriate, under FOIA and in terms of confidentiality, as well as with your new policies and procedures that were put in place in January 19th. Pursuant to the OHS order on confidentiality issued on September 17th, as well as corresponding supplemental orders you issued regarding our confidentiality, we welcome questions on any of the submissions. But again, thank you, Attorney Chuka, for reminding everyone that those would come in the context of an executive session to preserve our protections on confidentiality that are afforded under the order. The applicants acknowledge that we have the burden of proof in this proceeding, and you're going to hear that the facts supporting this legal standard required pursuant to Connecticut General Statutes 19A, 639A through 12 have been met. Specifically, the criteria that Dr. Gifford mentioned at the start of this proceeding. all of the specific criteria under that statute, as well as section 19A 639D2, which is specific to hospital affiliations, have been met. All the data and factual information provided in this docket, as well as the testimony of the witnesses you will hear from today, clearly support CON approval. Although not every statutory criteria is required to be met for this agency to allow a CON approval, the applicants have met that burden of proof and methodically demonstrated that each and every criteria has been met to allow the affiliation to proceed between Northwell and Nuvance. Applicants submitted a large amount of materials for OHS's consideration. To date, the record is in excess of 10,000 pages of material. So in light of the voluminous record, applicants submitted a legal brief, a bench brief, and we noted that's noted in the record as table ZZ. And the purpose of that legal submission is really to assist OHS with its review of the application and to highlight aspects of the filing and the materials submitted to demonstrate that in fact, each and every statutory criteria that you're required to review has been met. OHS will hear more on how the applicants has satisfied this burden on the statutory criteria from Attorney Jensen later on today in this proceeding during our closing remarks. One of the major directives, as you noted, Dr. Gifford, at the start of this proceeding, and is in furtherance of OHS's mission, is to improve the access, affordability, and quality of healthcare for Connecticut residents. As demonstrated in the filings to date in the docket, as well as the testimony you'll hear from today from our witnesses, approving the CON for the affiliation ensures continued access to high quality, affordable healthcare in the Danbury, Norwalk, New Milford, and Sharon communities. These service areas will be ensured of receiving essential critical services offered by these hospitals in order to be sustained and kept vital to keep healthcare local. Approval of the affiliation promotes equitable access in the community served by the Nuvance hospitals. And today, to further elaborate on how we've met our burden of proof and talk about how we're going to keep care local in these communities, offering testimony today in this specific order will be Mr. Michael Dowling. He's President and CEO of Northwell. Mr. Dowling will provide a brief overview of Northwell Health, its strong commitment to the community and the patient-centered healthcare, as well as the unique aspects of Northwell that has led to its continued and numerous recognitions of excellence. You'll also hear from Dr. John Murphy, Chief Executive Officer of Nuvance. He'll provide an overview of Nuvance Health and the extensive efforts of its staff on COVID-19 pandemic. He will also address the financial and operational challenges that Nuvance has faced emerging from the pandemic, the range of options their organization has considered in order to limit operating losses, and the process that led to this affiliation that's before you today. We will also hear from Mr. Daniel DeBarba, Executive Vice President and Chief Financial Officer for Nuvance Health. Mr. DeBarba will provide additional detail concerning Nuvance's Health's financial challenges, and he'll address how the affiliation with Northwell will allow Nuvance to stem financial losses and invest in hospitals and patient care initiatives. Providing testimony for Northwell's extensive track record and process in past affiliations is Mr. Mark Salazzo, who's President of Strategic Initiatives and Chief Operating Officer of Northwell Health. Mr. Salazzo will discuss Northwell Health's financial stability, its resources, and the numerous anticipated benefits of this affiliation. Mr. Salazzo will provide a detailed explanation of the significant and substantial system-wide capital commitment that Northwell is engaging in as part of this affiliation with Nuvance. Discussing aspects of the high quality that is exhibited at both systems will be Dr. Peter Silver. He's Northwell Health's Senior Vice President and Chief Quality Officer. Dr. Silver's testimony will focus on Northwell's system-wide approach to quality and safety and how that will benefit the community served by the Nuvance Connecticut hospitals. Each witness is here today to adopt their pre-filed testimony, provide further testimony in support of the COM before you today in our technical portion of our proceeding. We're here to answer any questions OHS has to further substantiate applicants have satisfied the requisite statutory criteria for approving this certificate of need application and for the affiliation of Nuvance Health with Northwell. At this time, I'd like to introduce Mr. Michael Dowling. He's going to again provide introductory remarks on Northwell. Mr. Dowling is the President and Chief Executive Officer of Northwell Health. He's one of healthcare's most influential voices, taking a stand on societal issues to better the communities we all call home. Michael has been working tirelessly since 1995 to further the charitable mission of Northwell Health, and his leadership has been invaluable to Northwell's tremendous success as an innovative health system. Michael has been honored with countless national and international distinguished awards for his substantial and significant contributions. A comprehensive biography of Mr. Dowling was included in the docket for your review. Mr. Dowling, if you would proceed, state your name again for the record and adopt your pre-filed testimony.
Thank you, and good morning. Good morning, Commissioner Gifford and the Office of Health Strategy staff. We appreciate the opportunity to be here. My name, to repeat again, is Michael Dowling, D-O-W-L-I-N-G, and I am President and CEO of Northwell Health. I am offering remarks on behalf of Northwell Health, an applicant in the above referenced certificate need application. I'm honored to be here to demonstrate Northwell Health's commitment to Connecticut, and more importantly, to the patients, employees, and communities served by Nuvance Health's Connecticut hospitals. I'm also here, as has been mentioned, to adopt my pre-filed testimony. I joined Northwell in 1995, and have been privileged to serve in the role of CEO since the beginning of 2002. Prior to joining Northwell Health, I was a senior executive in Empire Blue Cross Blue Shield. That's the large insurance company in New York State, as you know. Prior to that, I worked for New York State government for 12 years. I was the Deputy Secretary of Health and Human Services for Governor Mario Cuomo, and I was State Director of Education, Health, and Human Services for the state of New York, and also was Commissioner of the New York State Department of Social Services. I'm delighted and proud to be here today with Dr. John Murphy and Daniel DeBarba, CEO of Nuvance Health. Dr. Murphy will detail Nuvance Health's reasons for entering into this partnership with Northwell Health and why it is the best plan for the future of Nuvance, its facilities, and the communities they serve in Connecticut. I would also like to recognize Dr. Murphy and Mr. DeBarba and the entire executive team for their hard work and dedication throughout this affiliation planning process. It has been a pleasure to work with them, and all the nurses, clinicians, and staff whom we've had the pleasure to meet during our many local forums and town hall meetings at the various hospitals over the past many months. We look forward to all that is to come in the joint work that we can do together in the future. It's also my pleasure to introduce several representatives of Northwell senior leadership team who are here today to testify to the affiliation's many benefits for Nuvance and the residents of Danbury, New Milford, Norwalk, and Sharon communities. There has been mentioned already Mr. Mark Solazzo to my right, who is Northwell's President of Strategic Initiatives and Chief Operating Officer. Mark will testify about the resources and support Northwell can provide to Nuvance, as well as comment on the culture and capabilities of Northwell. You will also hear from Dr. Peter Silver, Senior Vice President and the Chief Quality Officer and Associate Medical Director of Northwell Health, who will describe the system-wide innovative approach to quality at Northwell and some of the benefits that can be realized from the partnership between the two systems, both of whom who are dedicated to the provision of the highest quality of care and the achievements that can result from our investment in a common electronic medical record system. Both, of course, are available to answer questions. At this point, I'd like to provide just a very brief overview of Northwell Health. We are a comprehensive, integrated system of care. It's a system that has grown through multiple affiliations over many, many, many years. We're a system that is integrated, but all components of the organization work together in complete synergy. And we serve over 2 million individuals annually. We offer at Northwell the complete continuum of care. We offer all services from birth to end of life. We are also more than hospitals. Only 47% of our total business is hospital-based business. We operate the largest primary care, the largest ambulatory and post-acute care list of services of over 900 locations, and the most comprehensive post-acute network of services in New York State. We have a major priority commitment to investing in top-tier talent through advanced education, strategic talent management, and targeted recruitment. We provide, and this is important to our culture, we provide a continuing culture of continuous learning for all of our employees. We're also the 4th largest academic teaching institution in the United States, with an innovative medical school and innovative nursing schools. We also have a major research entity called the Feinstein Institute for Medical Research, with multiple discoveries coming out of that institute on a continuing basis, and it is also the home of a new field of bioelectronic medicine. We're also, in our view, very, very important, and we are and always have been unbelievably mission-driven and community health focused, completely dedicated to caring for all in the community, regardless of circumstance, and investing in communities to improve health outcomes. We are in New York State. We are the 2nd largest provider of Medicaid in New York State. We are the 2nd largest provider of mental health services in New York State. We have the most comprehensive financial assistance policy in New York State and one of the most comprehensive in the United States. We are very, very engaged in all local communities as part of our catchment area and even beyond. And we tackle social issues that overall affect health. A couple of examples here where we're very, very involved and have taken national leadership roles in the area of gun violence prevention and safety, issues of climate change and sustainability, issues of food insecurity, issues of education, including high school education, where we're involved with over 80 high schools, and actually will be involved in the creation of our own Northwell High School of Health Sciences in New York, beginning in September of next year. And at our core is the commitment to a positive, collaborative, entrepreneurial, and results-driven culture. Culture is very important to us. We want to be the best place to provide care and the best place to work in care. We manage for the present, but we lead for the future. We think long-term. We have a track record of investing and strengthening our hospital partners. This is a record that goes back well over 25 years. We have a record of expanding care as needed in each local community. We believe in providing care as close to where people live as possible, as long as it can be done safely and with the highest quality. We are not a hub and a spoke system or a hub and a spoke model so common in many other health systems. So in closing, we at Northwell Health are extremely proud of what we have been able to achieve. We have a consistent vision, but have been adaptable in our tactical strategies. We constantly strive to learn and improve, and we look forward to the affiliation with Nuvance and are excited about what we can achieve together as an integrated system. I want to thank you for your time, and I respectfully request that OHS approve the application for the affiliation of Northwell Health and Nuvance Health. And I will now turn the mic back over to Michelle.
Thank you, Mr. Dowling. Next for the applicants in this technical portion will be Dr. John Murphy. He's the Chief Executive Officer of Nuvance Health. It's a position he's held since the formation of Nuvance Health in 2019 through the affiliation of Western Connecticut Network and HealthQuest. As CEO, Mr. Murphy establishes the vision, strategy, and priorities of Nuvance that includes 7 hospital locations, 2,700 aligned physicians, and more than 13,000 employees. A neurologist by training, Dr. Murphy held a variety of positions at Connecticut hospitals comprising Nuvance Health. We've also submitted a detailed bio for Dr. Murphy, which has been provided as part of the CON filing. Dr. Murphy, if you would please proceed, state your name and adopt your pre-filed testimony.
Sure. Good morning, Dr. Gifford, Attorney Chuka, and Attorney Jackson. My name is John Murphy, M-U-R-P-H-Y, the CEO of Nuvance Health, and I hereby adopt my pre-filed testimony. If it's okay with you, I'd like to give you a brief overview of what Nuvance Health is, who we are, how we were formed, what happened during COVID, and how we got here to this table in this room today, and why we're seeking a partnership, particularly one with Northwell Health. As you know, and Michelle just reiterated, we are a nonprofit, mission-driven health system comprised of 7 hospitals. We serve a population of about 1.5 million people, and we employ somewhere around 14,000 very talented individuals. Our hospitals have been in their respective communities for almost 150 years. A couple of them have been in existence for at least 140. And like Northwell, we provide care across the continuum, including pre-hospital care, inpatient and outpatient services. We have a large affiliated medical practice and offer post-acute care through our home care agencies. We have a long history and a proud history of teaching, and we have teaching programs with many residents and hundreds of physicians and other healthcare professionals who are in training, and we very much enjoy that. We have many educational affiliations with a host of academic partners within and outside of the state. We also conduct a host of research activities spanning not only clinical trials investigator-initiated trials. We also have now our own translational research facility. Nuvance Health was formed officially in 2019, although the talks began in 2017, when we brought together the two legacy organizations, which were at the time HealthQuest and Western Connecticut Health Network. We felt that bringing two similar not-for-profit health systems that were operating across Western Connecticut and through the Mid-Hudson Valley, made a great deal of sense. We created one board, 16 members, self-propagating board. We maintained the local hospital boards, and we created a single management team. And we had worked diligently with 23 integration teams, which had built plans that were in place to align operations in order to improve efficiency, reduce costs, and enhance patient care. And then March of 2020 arrived, and as you all remember, COVID came. We were the first hospitals in the state of Connecticut to admit a COVID patient. I think it was March 8th. The Danbury and Norwalk hospitals were hit hard and hit early. Actually, in the state for the first, had, as you may remember, within 4 days, a third of our ICU staff was out on furlough because of exposures, 90 nurses in one week. The census rapidly increased across both Connecticut and New York. We were using more than 10,000 masks a day by the end of the first week. And eventually, and certainly Dr. Gifford remembers this, we were operating under crisis standards of care. Unlike some of our competitors, not in the state of Connecticut, but others who did not admit COVID patients, we absolutely admitted every COVID patient that came to our door. And we also accepted hundreds of transfers from our smaller hospitals, as well as other hospitals in Fairfield County who at the time were similarly overwhelmed with COVID cases. And we also took cases from Manhattan. As you may remember, we opened a field hospital on our Danbury campus. We also staffed the 250-bed Army hospital located at the O'Neill Center at WestConn's campus in Danbury. And we worked closely with the National Guard through those months. I think it's important to understand that, as you undoubtedly realize and remember, we helped write the clinical playbook because there wasn't one in place in the first and second week in March. We figured out when to intubate and then ultimately when to avoid intubation, what the proper role of anticoagulation was, when to use steroids and when not to use steroids. We helped establish the role of hydroxychloroquine and the introduction of IL-6 inhibitors. We co-led a study with Johns Hopkins on the value and use of convalescent plasma and ultimately remdesivir, and we spared no expense. We transitioned thousands of employees to work from home and put up hundreds of employees at hotels to address their very real concerns about bringing the virus home to their loved ones. I remember one night we had 250 employees in local hotels. We were the first hospital in Connecticut to stop elective procedures, and we led a statewide coalition in cooperation with your office and Governor Lamont to convince all hospitals to follow suit. We established, built, and staffed multiple testing sites across the western part of the state. And when the time came, we became the major source of the effort to vaccinate all of the communities we served. We played a major role in the health system response team. And as Dr. Gifford knows, while I chaired the board of CHA throughout COVID, we helped shape the state's strategy in many ways. I think it was every Thursday we met. I think the governor gave us off Thanksgiving for almost 2 years. What you may not know is that we were also in the midst of building a state-of-the-art hospital on the beautiful Hudson River. The construction of that hospital came to a complete standstill when multiple construction workers didn't show up. This led to enormous delays in addition to huge unanticipated expenses that we had to fund in order to safeguard the work site and test all of the employees who were working on that construction. These delays pushed the completion back nearly a year and caused budget overruns in excess of $100 million. We had to fund that. By the time the pandemic ended, our staff had performed brilliantly. We saved countless lives, and we did it despite the enormous expenses associated with battling a once-in-a-lifetime pandemic. But we soon found ourselves with 2,000 staff vacancies, flat volumes, frightened patients, an exhausted workforce, and enormous operating losses. We were unable to fully realize the efficiencies that our 23 integration teams had so carefully planned for, because it was all hands on deck for nearly 2 years. Even our IT systems, our IT platforms remained functionally distinct systems. In 2022, the median operating margin for hospitals in the United States was a negative 3.8%. We weren't spared those losses. We were in the same boat as many others. Our labor costs per discharge rose 37% since pre-pandemic levels. Our supply costs per discharge rose 18%, and even our food costs per discharge rose 12%. Inflation at the time, as you may remember, was just at 7%, and yet our managed care rates were locked, and they couldn't keep up with the increased costs that we were facing. Like every other prudent business owner, facing serious financial distress, we considered a range of options. Cut costs. We brought in the Berkeley Research Group, starting actually in late 2020, and we did take out enormous costs, but with surgical precision. Other options, raise prices. Well, we weren't able to do that, and we all know, why and how that works. Restructure debt. We did that. We restructured the debt on our balance sheet. Eliminate underutilized or consolidate underutilized services. We tried that, but had limited success. Add new services. That too was more difficult than we anticipated. Ultimately, we could adopt a new business model or pursue a combination with a partner. In the summer of 2022, I went to the board, it's actually in July of 22, and proposed that we consider the latter. And we had actually had several board retreats, both in 2020 and in 2022, and I think this is a healthy thing for boards to do, is to examine the strategic options. What should we do? Does it really make sense? Is it in the best interest of the community for preservation of the mission to remain independent? So we had asked and answered the question and thought through it on a number of occasions. So we were not flat-footed when it became reality. To get everyone on the same page, in late 22, we asked the question, so what exactly would it take to remain independent, yet serve our communities in a way that you would all be proud of? And fundamentally, it came down to we would have to grow the physician enterprise and aggressively move into the ambulatory space. But we were capital constrained, and we had just had a credit downgrade because of our losses. So access to capital was a real challenge. In March of 23, I went to the board with Dan DeBarba and we said, look, it is time to find a partner. The risks of trying to pull this off as a standalone system are simply too great. So we agreed in 2023, in March, to begin the process of finding a partner. We formed an ad hoc committee of the board and we engaged Kaufman Hall, who were national experts in this space. We then began a thoughtful, deliberative, and thorough process focused on finding the right partner. The criteria that we used were largely based on three areas: cultural compatibility, financial strength, and clinical excellence and clinical competence. And those were the lenses through which we examined initially 25 partners, then 8, then 5, and then made our final decision. And I will say that Northwell was our clear and unanimous choice. There was no ambiguity or uncertainty. We were absolutely convinced that they were the right partner. I've known Michael for 8 years. We've worked together on a number of projects with Northwell, so we were very comfortable that we knew what we were getting into and who we had chosen. We chose Northwell because of their willingness to, as Michael just said, they're grounded in the communities they serve. They take the notion of community health very seriously. And also they wanted to keep care local. And through our own due diligence, I discovered that that is in fact absolutely true. that whenever possible, care remains in the local community. They also demonstrated a willingness to make a significant capital commitment, which was very important to us. But they also have, I think, a distinguished history of turning hospitals around that were facing financial distress. They're good at it, and they do it thoughtfully and without injuring the community or the staff. And as Michael said, they really do believe in creating a learning environment, and I love that about the place. It is at the heart of their inclusive and innovative culture. So as we look ahead to our future with Northwell, I see a future of improved healthcare for all those we serve. For our patients, I believe this partnership means expanded access to affordable and equitable care, including the most advanced treatments and broader specialty services through every stage of life, elevating the quality of care while keeping it close to home. Our physicians will have even greater opportunities to work with the exceptionally talented staff at Northwell, coupled with the resources to explore and apply emerging technologies that drive innovation in patient care. For many physicians, they will enrich their professional lives by pursuing research interests through the Feinstein Research Institute portfolio, or rediscovering the joy of medicine by continuing to teach in association with not only Zucker School of Medicine, but others, the next generation of healthcare professionals. Our employees will benefit from career growth pathways supported by Northwell's deep commitment to continuous learning and skill development, empowering our staff to deliver exceptional care and helping them build careers they never thought possible. For our communities, this affiliation with Northwell represents a very real commitment to sustainable, locally anchored, integrated healthcare delivery that will absolutely contribute to the region's well-being and economic vitality, which is important to all of our communities and this state, while at the very same time paving the way for breakthroughs in medical science. It also means that care will be delivered in contemporary facilities, including the Norwalk Hospital Pavilion, which we have been trying to get off the ground for a number of years. Together, we will build a resilient health system poised for the future and well-equipped to meet the evolving needs of our stakeholders for years to come. I respectfully request that you approve this application, and that concludes my testimony.
As Mr. Daniel DeBarba is coming up, I'll offer a few remarks about Mr. Dan DeBarba is Executive Vice President and Chief Financial Officer for Nuvance Health. Dan leads all Nuvance Health financial, contracting, supply chain, revenue cycle, and information technology teams. Dan previously served as the President and Chief Executive Officer of Norwalk Hospital and later President of Danbury Hospital and New Milford Hospital as part of Nuvance Health's predecessor, Western Connecticut Health Network. Mr. DeBarba, if you'll please proceed and state your name and spell it for the record and adopt your pre-filed testimony.
Sure. Good morning, Commissioner Gifford, Attorneys Chuka and Jackson. My name is Dan DeBarba, D-E-B-A-R-B-A. I am the Chief Financial Officer of Nuvance Health. And for the record, I adopt my pre-filed testimony. So Nuvance Health has encountered significant financial challenges, and without solution, these challenges threaten the breadth of the services we provide and the well-being of the communities that rely upon them. You've just heard from Dr. Murphy as he described many challenges and why they necessitate this affiliation. Nuvance Health has incurred significant operating losses in recent years as we emerge from the pandemic, and in fact, over $300 million in operating losses when you consider fiscal year 2024 just ended. These operating losses have reduced our liquidity and clearly restrained our access to capital markets, which in turn has limited our ability to reinvest in our system. My team works every day to assess our finances, to seek opportunities to improve performance, and make decisions in the best interest of our short and long-term viability. And we've clearly had success in this area, but it hasn't been enough given the challenging environment in which we operate. And we are simply at the point where we need more help from a like-minded, mission-oriented partner. Given Northwell's record of accomplishment, its commitment to invest in Nuvance Health is essential to the patients and communities we serve. The proposed affiliation with Northwell will bring best-in-class clinical, operational, and financial capabilities to help support Nuvance Health and its mission. At Nuvance, we truly have great facilities, an incredibly dedicated staff, and a sound, thoughtful, strategic plan. And with the influx of capital from Northwell, along with the integration of their talent and expertise, our system will undoubtedly thrive. Northwell is committed to making crucial investments in our operations, in our facilities, and in our electronic health record system. These are investments we currently cannot afford to make on our own, but are crucial to ensuring access to high-quality, cost-effective care in our communities. For several years, I was the Chief Financial Officer of Catholic Health of Long Island, a significant competitor of Northwell. I like to think we were a significant competitor of Northwell. And from that vantage point, I watched Northwell lift up struggling health systems. I witnessed how they delivered on their commitments to these health systems and greatly admired their dedication to relentless improvement of healthcare delivery in the many communities they serve. Northwell Health is the right partner for Nuvance, and this application should be approved. Our financial challenges are undisputed, and the best remedy for them is clear: disaffiliation. It will help us stem our losses and return our system and our staff's focus back to the delivery of high-quality care close to home. So I strongly urge the Office of Health Strategy to approve this application as soon as practicable. And of course, I look forward to answering any questions you have at the appropriate time. Thank you.
Thank you. Mr. Mark Salazzo will be testifying for the applicants and the approval of the affiliation. Mr. Salazzo serves as President, Strategic Initiatives and Chief Operating Officer of Northwell Health, providing leadership and oversight to all operations of Northwell, including its 21 hospitals and almost 900 ambulatory sites. Northwell's internationally recognized medical research institute, as well as various healthcare-related businesses. Mark oversees the largest private workforce in New York State, and he's responsible for integrating the strategic plan of the organization. He works closely with senior leadership and management to successfully implement Northwell's strategic objectives, providing management oversight for first-class, cost-effective, and integrative programs to ensure the operational success of the charitable organization. Mr. Salazzo serves on numerous boards and is an officer and both director. A comprehensive biography of Mr. Salazzo is included in the record, and I'd like to turn it over to Mark if he please adopt his pre-filed testimony. State his name for the record.
Thank you. Good morning, Commissioner Gifford, OHS staff, members of the public joining us today. We thank you for the opportunity to speak to you today. My name again is Mark Salazzo, S-O-L-A-Z-Z-O, and I would like first to affirmatively adopt my pre-filed testimony. I'll provide very briefly for you today a description of Northwell's past successful affiliations, the expected patient, employee, and community benefits that will result from this affiliation, Northwell's strong financial position and resources, which will allow us to fulfill the strategic and capital commitments to Nuvance Health, and finally, what does the post-affiliation governance look like? Northwell's past successful affiliations are best illustrated by this timeline. Northwell has continuously evolved over the last 35 years, of which I have had the personal honor to serve this organization and our CEO. Michael Dowling, for 30 of those years. Prior to that, Michael and I served within New York State government. Michael is the Deputy Secretary to the Governor for Health and Human Services. I worked in the New York State Department of Social Services on a range of health, mental health, social services, and Medicaid issues. Together, along with the many leaders that have joined us here today, we have personally led the evolution of this health system. Our success is due to our culture, our team members, our commitment to developing a clinically integrated health system, which has allowed us to be more nimble and flexible. As Michael said earlier, we are not a hub and spoke model. Our mission is to deliver appropriate, safe care to our patients as close to their homes as practical. We strategically invest in each member hospital and build individualized clinical programs that focus on quality, safety, community need, and equity. Our approach to integrating and revitalizing community hospitals is simple. It starts with the philosophy that care must be strengthened in the community and from the bedside out. Our approach: we assess community need, we address life safety and immediate infrastructure and equipment investments needed by each institution, and then we extend and build clinical programs to fill clinical gaps. We look at ambulatory and inpatient as a continuum, focusing on specific disease processes. We extend clinical centers of excellence and create a quality-centered environment to attract and retain talent. This model has allowed Northwell Health to continually improve and enhance the delivery of care across local communities, delivering local, quality, safe, convenient, and cost-effective care. In every instance that we have merged with community hospital, we have stabilized and expanded services as needed. We have increased access and enhanced quality care. We preserved jobs and enhanced and expanded employment. We exceeded our capital commitments and achieved cost savings. This affiliation will be no different with Nuvance. I will give two brief examples that will support and visualize what I mean. Let me start with Lenox Hill Hospital. Before Lenox Hill Hospital joined us in 2010, they were in financial trouble. And of greater concern, they had a significant number of life, safety, and quality issues that needed to be immediately addressed. The way we approached our affiliation was to take care of those issues first. That was paramount, to provide a safe environment. Then we developed a plan to reverse the declining financial trends by looking at the landscape to fill clinical gaps and expand needed local services. One such clinical gap, as an example, was the closure of St. Vincent's in downtown Manhattan. Shortly after we affiliated with Lenox Hill Hospital, we filled that gap by working with the community, creating an emergency care, full-service freestanding emergency center for the residents and communities surrounding the closure of St. Vincent's. We also expanded services in the areas imaging, ambulatory surgery, specialty practices, and cancer. At present, Lenox Hill Hospital, we are a tertiary academic medical center, a leader in public education and community outreach. Proud to be U.S. News and World Report's top-ranked hospital, recognized for clinical excellence in cardiovascular care, neurology, neurosurgery, OBGYN, maternal health, and more. Dedicated to charity care, providing $40 million in charity care and $123 million in other community benefits, and a 4-star CMS hospital. As we look to the future for Lenox Hill, we will continue to invest in their infrastructure and their expanded services. Lenox Hill Hospital is an older hospital. Some parts date back to 1880s, and the most recent was built in 1972. So we're in the process of building a replacement hospital for Lenox Hill Hospital, and that will take us some time to obtain those approvals. With respect to needed services, there's a pending closure of Beth Israel in Manhattan. We are expanding clinical services at Greenwich Village to include cardiac cath labs and other additional ambulatory services to meet the community need. Second example that I'll give is South Shore University Hospital, formerly known as Southside Hospital. This was a little bit of a different story. They were experiencing significant losses and basically had no cash on hand. Its life and safety infrastructure was in dire need of upgrade. The neighborhood that surrounded South Shore had many low-income residents and was a depressed area. It was designated by New York State as an economically distressed institution. Our approach here started with making sure that everyone in the surrounding communities had local access to local quality care. Again, we looked at the landscape. We developed a plan that would stabilize the institution, support the critical needs of the community, and then expanded and built programs. We addressed critical access first. We expanded the emergency department that today serves a largely undocumented migrant, low-income population. 1 out of every 5 ED visits result in an unpaid bill in that institution. We expanded program. We extended our cardiothoracic surgical program from Northwell University Hospital and extended to South Shore. The idea of we're not a hub and spoke, and if we could provide care safely local, that's what we're going to do. Why did we do that? Because at the time, 30% of Northwell University Hospital's cardiothoracic volume was coming from the communities that surrounded South Shore. By extending the program, we were able to provide safe care closer to home. We will continue to invest in neurosurgery and orthopedic programs for them as well. At present, they are a level 1 trauma center, a primary stroke center, a level 2 perinatal center, and they're proud to be U.S. News and World Report's top-ranked hospital for heart surgery. They're a center of excellence in heart, orthopedics, neuroscience, women's health, and so much more. And they provide $24 million in charity care and provide $55 million in other community benefits. We will continue to invest in them. There is high demand for their services, so much so that we're in the process of building a 6-story inpatient surgical tower to meet the local community demand. With respect to Northwell's financial stability, Northwell has the resources to be able to commit to the long-term stabilization and growth of institutions. We have the talent, the culture, the experience, and the financial resources to achieve this. We sustain a significant balance sheet. We maintain stable ratings with Moody's, S&P, and Fitch, A3, A- and A- respectively. We maintain excellent credit ratings and access to the debt market. The next 3 slides at a high level will provide an overview of the affiliation and its expected benefits. The affiliation, it creates a single system through the combination of 2 entities with complementary service areas and cultures and missions. Northwell and Nuvance share a strong patient-centric and community-based mission. Together, we will be able to improve access to high-quality care, enhance, share, and advance best practices among our institutions, increase operational efficiencies, enable long-term investments, execute on key growth initiatives and capital needs, and support localized healthcare. Northwell is committed to a 5-year capital commitment of $1 billion. This table outlines our commitment in 4 buckets. The first, base capital for life, safety, and infrastructure. A range of $400 to $500 million is our estimate. Facility capital for major capital modernization, a range of $150 to $300 million. Growth capital focused on expanded ambulatory access and filling localized clinical gaps, a range of $100 to $200 million. And implementation of Epic EMR, a range of $175 to $225 million. Pre-planning for Epic has already begun, assessing the IT infrastructure, the technology, and Epic adjacent applications. We expect implementation to start year 3 following the date of the affiliation. There are numerous expected benefits from the affiliation. I won't read all of these. I'll just point out a couple to highlight. First, for the community, preserving access to needed care and services. For Nuvance team members, retaining local employees, respecting existing union agreements, and focusing on talent and employee engagement. And then finally, not the least of which, for the patient, working together with Nuvance to enhance quality in healthcare, implementing the Epic EMR to enable more enhanced, coordinated, and efficient care. Finally, post-affiliation governance. I will do my best to try to introduce this topic. Dr. Larry Kramer, our general counsel, will be available for any more difficult follow-up questions. The key takeaway of the post-affiliation structure is the following. First, there is no direct change of ownership of Nuvance. Northwell Inc. and Northwell HS becomes the parent of Nuvance Health. Nuvance Health becomes the mirror board of each of the individual Connecticut hospitals. The individuals currently serve on Nuvance community boards will serve on the community advisory board of that local hospital. Commissioner Gifford, thank you for providing us this opportunity to speak with you today about the CON and the affiliation benefits. I respectfully request that OHS approve the CON application. I believe it will benefit the patients, employees, and the greater communities of Danbury, New Milford, Norwalk, and Sharon. I'll now hand this back to Attorney Michelle Volpe to introduce the next person. Thank you.
Thank you, Mr. Salazzo. Last but certainly not least, as part of our technical proceeding, the applicants, we have Dr. Peter Silver. He's Northwell Health Senior Vice President and Chief Quality Officer. As Chief Quality Officer, Dr. Silver is responsible for the overall quality of care in the Northwell hospitals, ambulatory sites, and system-wide initiatives in quality and safety. Some of these initiatives have included preparing Northwell Health's clinical operations for the possibility of an IT downtime, something that we're seeing a lot of now in today's markets. He has the ability in assisting in reducing hospital-acquired infections and optimizing surgical and procedural safety. Dr. Silver has participated in leadership roles in several quality initiatives at the national level, including those from the Joint Commission Center for Transforming Healthcare and Children's Hospitals Association. Dr. Silver is a fellow in the American College of Critical Care Medicine, American College of Chest Physicians, and American Academy of Pediatrics. A biography of Dr. Silver was included in the docket. Dr. Silver, if you would please proceed, state your name, spell it, and adopt your pre-filed testimony.
Good morning, Commissioner Gifford and members of the Office of Health Strategy. My name is Dr. Peter Silver, S-I-L-V-E-R, and I am here to adopt my pre-filed testimony. Quality is at the center of everything we do at Northwell. It is our foundational pillar. Northwell quality is highlighted by our shared culture and our working together as an integrated health system, what we refer to as our systemness. I'm not sure if that's a real word, systemness, but we say it all the time. Culture and system. First on culture, our culture is one of daily continuous improvement, where we strive to do better tomorrow than we did today. If there's a problem that we've identified, we fix it. If there's something that we do very well, we try to do even better the next day. We do this to optimize our outcomes and health for all of our patients, to deliver the highest caliber of patient-centered care, driven by our culture of compassion and our continuous pursuit of clinical excellence. At Northwell, good enough isn't. We try to do better every day. Now on to our systemness. As you've heard from Mr. Dowling, Mr. Salazzo, we work together as an integrated system with coordinated system-wide efforts involving all of our hospitals and ambulatory sites. We have many hospitals, hundreds of ambulatory sites, but we work together as one system. And through this system, we develop standards, best practices. We monitor our data closely through an extensive quality infrastructure led by our central quality department, which I oversee. Our integrated leadership groups involved in these efforts include our inpatient and ambulatory medical directors, our nurse leaders, which constitute our Nurse Executive Council, our quality leaders, which participate in our Institute for Clinical Excellence, Quality, and Patient Safety. In addition, some of our many system quality teams and task forces include our Center for Maternal Health, where we aim to reduce maternal morbidities and mortalities, especially for Black women. Our Center for Equity of Care, where we aim to address health disparities, social determinants of health, and make sure that our health outcomes are equal for all. Our age-friendly healthcare task force, all of our hospitals are credentialed by IHI as age-friendly. Our readmissions consortium, we've had a significant reduction in our readmission rates over the last 5 years. As Attorney Volpe mentioned, we have a task force committed to the preparation of information technology downtime, IT downtime. We don't view IT downtime as an IT issue. You don't have IT when you're on downtime. It's a clinical patient issue. How are you going to take care of patients when you lose your EHR? We have a sepsis collaborative, multidisciplinary across the board sepsis collaborative, and a central line bloodstream infection reduction collaborative. And I'll just take a time out to tell, I was at a meeting of the IHI, Institute for Healthcare Improvement, in April, and had to go around the room and say something, an achievement. What are you proud of? I said, well, last month we didn't have any catheter-associated bloodstream infections. They said, wow, which hospital? I said, no, all of our hospitals across the board, we had none. And that's an incredible achievement, I guess, but it's something that we still strive to do every month for all of our hospitals. Our success is evidenced by multiple recognitions. Our CMS star ratings have increased from an average of 2.2 stars in 2017 to 3.7 stars this past year. In terms of leapfrog, of our 15 hospitals, we had 11 A's and 3 B's. Michael and Mark mentioned U.S. News World Report. North Shore University Hospital is tied for the best hospital in New York State, and one of 20 hospitals in the United States in the U.S. News Honor Roll. We have 50 rankings across Northwell in the top 30, 11 in the top 20, more recognitions in U.S. News World Report than any other hospital in New York State. I think what I'm equally proud of, in addition to North Shore, is we have several of our community hospitals which have hit the U.S. News World Report top 50 list as well. And that just indicates how all of our sites strive to be the best every day. We have 11 magnet designated hospitals. That's the highest recognition given to nursing by the American Nursing Credentialing Center, including Zucker Hillside Hospital, one of our psychiatric centers, and Zucker Hillside is only the 5th psychiatric center to achieve magnet designation in the United States. We're very proud of that. We have many other recognitions. What I'm extremely proud of is unit-based honors, Get With the Guidelines, American Heart Association, Beacon Awards, et cetera. And that just reflects our culture of all of our employees to do better, to be the best every day. And although we're a bit competitive, we definitely subscribe to the philosophy that we all share and all learn. That's part of us being part of a system. As Michael indicated, our quality efforts go beyond the walls of our hospitals and into our communities. Our public health quality efforts include the Center for Gun Violence Prevention. Michael didn't mention, but he hosts an annual gun violence prevention forum with nearly 500 organizations participating annually. We have a program for prevention, recognition, prevention, intervention of human trafficking, program of improved access to mental health for adolescents. We all know the significant adolescent mental health crisis that exists today. Food is health, care of homeless people, and as Michael indicated, educational programs, particularly to disadvantaged in communities in need. Like Northwell, quality is also at the center of everything that Nuvance does. And that makes us all very, very excited for the affiliation with Nuvance. Nuvance's dedication to quality is evidenced by improvements that have been seen since forming as a system in 2019. Their improvements in health grades, leapfrog, CMS stars are all evidence of that. And so we're looking forward to partnering with them and having them join our integrated system and collaborative efforts to join us in doing better each day, just as other hospitals that have joined us over the last many years have benefited from joining Northwell, as evidenced by improvement in CMS stars and many other quality metrics. Finally, I'd like to comment on Nuvance's planned upgrade to Epic as an electronic health system and the quality benefits that will derive from that. I think this will help support Nuvance's quality efforts in ways very important to the communities they serve. First, sharing of information across the health system with a common electronic health record from the inpatient to the ambulatory setting across the health system, as well as sharing of information with other large health systems in Connecticut. As you know, Yale, Hartford Healthcare also use Epic, and the ability to share patient information across health systems will lead to better coordination of care, improved efficiency, improved quality, less duplication. Improved efficiency at the bedside will free clinicians from time spent on documentation and lead to improved quality. Improved data collection through Epic will enhance performance improvement efforts and results. The built-in logic and programming that exists within Epic, not available in the current electronic health records, such as pre-surgical programming, medication safety algorithms, or even artificial intelligence-based programs such as deterioration prediction or sepsis prediction, will clearly benefit patients in Nuvance. And not insignificantly, on Epic, patients will have enhanced access to their own medical records, which is a great, not only patient satisfier, but will also lead to improved quality. So in summary, we are all very excited at the prospect of having Nuvance join Northwell and our integrated system of quality improvement. I think joining forces with Northwell will be extremely valuable to Nuvance and the communities it serves. I thank you for the opportunity to allow me to testify today, and I'll now turn it back to Attorney Volpe.
Thank you, Dr. Silver. That concludes the applicant's testimony today and in our technical portion of the proceeding.
So we are going to proceed to the limited interveners. And then we will probably take like a 10 or 15-minute break after that. I know we've been going for a while. And I do appreciate everybody's endurance. So Attorney Knog, would you like to make an opening statement on behalf of the interveners?
Yes, thank you. As you know, I'm Attorney Paul Knog from North Carolina, and I represent the interveners, Safe Sharon Hospital, and Doctors Mortman and Kurish. And Dr. Kurish is now here with me, along with Dr. Mortman. After the filing of this CON, we made the decision to contact Northwell through Attorney Volpe because we had various concerns about things that were happening relating to the labor and delivery and PCU CONs in which we had participated, as well as other matters relating to Sharon Hospital. And as a result of that contact, certain immediate steps were taken to address certain immediate concerns, and there were 3 meetings that were held in Sharon between ourselves and Mr. Salazzo and Mr. Kevin Beener, who's also here today, on behalf of Northwell. And we were particularly appreciative of the fact, and it was a good day. The leaves were turning, and it was a nice day to drive up to Sharon, but it's a long drive to Sharon from out where they are in New York. And they did it 3 times. And it showed us that they were really concerned about interfacing with us and addressing our concerns. And, you know, one of the things that they say is they're not a hub and spoke hospital. So what we found is that many of our concerns about the services at Sharon and the doctors at Sharon were concerns that they would address as part of their normal business model. And so what we did was we agreed on a long series of conditions that would be requirements that would be put into the CON when you approve it, you know, of course, with your approval, but we agreed on what their commitments could be. In the past, when there have been changes of ownership, typically there are conditions about what the transferee would do to support quality care in the existing hospitals. And that, as you know, that's one of the criteria that the commissioner mentioned in her opening statement. And so we had this letter, which is attached to our petition to intervene, which we hope you'll incorporate the commitments into your decision. They agreed to a dedicated effort to grow Sharon Hospital maternity service by using appropriate marketing, by recruiting and engaging the needed staff and physicians based on market appropriate rates, and by increasing call pay for community physicians to market rates. This includes, and there would also be recruitment of various needed doctors, including at least 2 OBGYNs, and that they would provide appropriate engagement vehicles to community physicians to promote recruitment, such as possibly an income guarantee or other recruitment vehicle. They agreed to provide 24/7 surgery capability and maintain a full service ER. As to the PCU, which was approved based on Nuvance's pledge to maintain the prior ECU's existing capabilities, it was agreed that staffing would be maintained in accordance with the agreed settlement that was entered into in the PCU matter, and that telemetry capability would be extended to the entire PCU unit. And the intent would be that the recent major reductions in PCU utilization would be reversed. They also recognize the need to recruit physicians in various areas. The physicians in the Sharon area have been depleted, and they agreed that they would seek to recruit physicians in primary care, family medicine, general surgery, and various subspecialties, including urology, neurology, and pulmonary. They promised that they would engage the community, as they had been doing with us by coming up there 3 times. Part of that would be to appoint a Save Sharon Hospital designee to the Sharon Hospital Advisory Board after the consummation of the transaction. You know, our ask here is please incorporate these commitments that have been made by Northwell into the decision. We're really, really happy with Northwell and with their engagement with us and with their commitments to us and to our community. There's been a great deal of concern over the years, and I think that Northwell is going to effectively address these concerns, and particularly based on the commitments that they made to us. And so we're happy that Nuvance has chosen Northwell as their new partner, and we urge that that this CON be approved at the earliest possible moment. So now I would turn to our first witness. Now, Dr. Howard Mortman is something of a hero in Sharon. He is the man that has done most of the deliveries at the Labor and Delivery Center. He is the man that has worked really hard to keep labor and delivery available. He works a day and night to get him to even do testimony for this proceeding was difficult because he's so busy, particularly now that the community knows that L&D is here to stay at Sharon Hospital. He's been so busy delivering babies and dealing with various emergencies. So with that, I'd like to turn the mic over to Dr. Mortman. And Doctor, would you adopt your pre-filed testimony?
Sure, I adopt.
Yeah,
Yeah.
Doctor, before you start, Attorney Knag, would you mind introducing Dr. Kirsch as well? And then I'll
Yeah.
swear them both in, and then
Yes.
they can
Dr.
continue.
David Kurish is here. And we welcome him. He is a practicing physician at Sharon Hospital for many years, and his particular area of concern is the ICU and the PCU where he practices.
Thank you. Can you both raise your right hand, please? Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you provided in your pre-filed testimony and the evidence that you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
Thank you. You can proceed.
So,
And before you start, sorry, I should have said this. The order did specify that there would be time constraints on the interveners as well. So I'll just remind you that you should keep your comments to 10 minutes each.
greetings, Dr. Gifford, attorneys Chuka and Jackson, all those in the room that have made the effort to be here, all those that are electronically connected to us. And something that I didn't put on my little speech here is just a great thank you. This is a great day for all of us, and particularly for the patients served by my hospital, at least from my perspective. So
Can you just move the mic a little bit closer?
thank you for this opportunity to speak. The lives and quality of life of those in Sharon and its surrounding communities in both New York and Connecticut. OBGYN physician that trained at Yale and New Haven, Connecticut, and I've been a full-time OBGYN providing comprehensive obstetrics and gynecological care to families in our area since early 1991. I've delivered thousands of babies at Sharon Hospital since then. My 3 children were born at Sharon Hospital. My sister Gail is developmentally disabled due to a delay in healthcare at the hospital when my mother was giving birth to my sister. I told my mother in high school I was going to become an obstetrician to prevent this from happening to other families. Within the last year, I asked my sister, who is high functioning, to pray for the viability and continued availability of labor and delivery services at Sharon Hospital. I speak with her every week, and she reminds me that she continues to pray every week. After the affiliation with Northwell, we want to make sure we continue to have a world-class labor and delivery unit at Sharon Hospital, as reflected by our safety record and the quality of care that we provide our patients. We want to continue being consistently at the top of the metric charts comparing the Nuvance hospitals regarding quality, safety, and patient satisfaction. We are pleased that Northwell has met with us and entered into a letter agreement that includes numerous steps that they pledge to take to ensure this continues. We live in a very rural area that is quite isolated by distance, often compounded by weather. No one knows this better than me. It's a necessity that Sharon Hospital remain a full-service hospital that includes labor and delivery. This need is profound and unassailable. Without labor and delivery, our area would become a healthcare desert and endanger the lives of women and their future children. Going forward, we must ensure that women and families in this area will not suffer the inevitable dire consequences that would happen without full-time labor and delivery services, including 24/7 availability of expert obstetricians, pediatricians, anesthesiologists, and dedicated labor and delivery nurses, as well as having 24/7 operating room capabilities. There are countless examples of potential disastrous outcomes leading to mortality and morbidity that would have and will occur if not for these local ongoing services. Most importantly, we need to recruit additional OBGYNs to Sharon Hospital. I've not been able to recruit a new partner for full-time coverage for the labor and delivery floor because of the uncertainty of ongoing administrative support for maternity. Now, based on the commitments both Northwell and Nuvance have made to sustaining labor and delivery, I now feel confident in moving forward with recruitment. We need, however, an income guarantee or other form of recruitment incentives to offer future partners. Northwell pledges that it will address this. We also need market rate call pay so that it can be adequate.
Okay.
In September, I was on call every single day except for one. In October, I was on call most days, and I'm scheduled to be on call all but 6 days in November. This coverage includes covering the emergency room for any OB/GYN emergencies, being available for consultation throughout the hospital, covering a Nuvance employed gynecologist who does not take call 24/7, and of course, covering labor and delivery. We need to be properly reimbursed for these services at a rate that would allow me to find other obstetricians to provide call coverage in the short and long term. We also need recruitment of pediatricians and nursing staff. The Northwell letter includes commitments to address these issues. This needs to be done expeditiously. I've had the opportunity to meet with top Northwell executives on 3 occasions in recent weeks. They have pledged to me personally a commitment to keep full maternity services available at Sharon Hospital indefinitely, to bring reimbursement rates for coverage to an appropriate level, and to vigorously help with recruitment. They have promised to work with the OB/GYNs and individuals that truly represent the community to strengthen comprehensive services for women and their families. They understand the need to advertise to the community that Sharon Hospital maternity services are open and here to stay. They are committed to recruiting for general surgery so that we will once again have 24/7 general surgery coverage. They also understand the need to recruit urology. While I have highlighted certain commitments from Northwell's October 22nd, 2024 letter to Save Sharon Hospital, I deem all their commitments to be important to an overall goal of building up the capabilities of Sharon Hospital and improving the availability of care in Northwest Connecticut. When speaking to physicians that have worked in Northwell hospitals, I consistently hear that Northwell does what they say they're going to do. Without exception, I keep hearing that from many people. Generally, people enjoy working for Northwell and say they have integrity and that they are capable and dedicated. These Northwell executives that I've met with have let me know in no uncertain terms that they do not plan to cut any services and instead plan to grow services at Sharon Hospital, and I implicitly believe that. Admittedly, at first, I was concerned about this big organization taking over our small community hospital, but I've come to feel just the opposite. I think this is an extraordinary opportunity. I think they have shown that they care greatly about Sharon Hospital and are excited about what opportunities will unfold as we reinforce and grow our capabilities. OHS, please consider including promises Mr. Salazzo from Northwell wrote to Save Sharon Hospital in the letter dated October 22nd, 2024 into the agreed settlement. I trust that Northwell will do what is right for our hospital and our community, and that they will follow through on these promises. Obstetrics and gynecological services have been a big contributor to the ongoing track record of Sharon Hospital's 5-star overall rating. In fact, this year, we're the only hospital in the state of Connecticut with a 5-star rating for safety, and we are determined to continue providing this quality. We have always been a beacon and an example for others to look to for delivery of local essential healthcare of the highest quality and safety and with top patient satisfaction. I want to thank OHS and all the politicians in the state who've heard the cries from myself and my community for keeping maternity open at Sharon Hospital, including Senator Richard Blumenthal, Congresswoman Joanna Hayes, Attorney General William Tong, Controller Sean Scanlon, State Representative Maria Horn, State Senator Steve Harding, and all of our local elected officials. I thank them wholeheartedly for their unwavering support. Let's get this done quickly. Northwell's hands are tied to a large extent until this process is completed, and our needs are urgent. Respectfully and with thanks.
Okay, let's let David, can you change seats with David?
Yeah.
Our next witness will be Dr. David Kurish, who, as I mentioned, practices in the PCU and is a leading spokesman to preserve and enhance its capabilities.
Good morning, Dr. Gifford and OHS staff. I'm David Kurish, a board certified internist with a fellowship in cardiology from the University of Rochester. And I've been practicing in Sharon Hospital for 46 years. I've cared for tens of thousands of patients, including patients in the ICU, performed thousands of consultations. I have firsthand knowledge of the recent conversion of the ICU to a PCU, and have witnessed the deterioration in medical services available to our community as the hospital has changed ownership in the past 5 times the past 20 years. As with the maternity unit, you cannot have a hospital without an ICU. It's crucial to maintain the ICU level of care at Sharon Hospital for 4 reasons. First, due to a large growing elderly population with complicated medical problems in the catchment area of 50,000 residents, rapid access to critical care is crucial. Second, to provide the care these patients require, Sharon Hospital must maintain highly trained critical care nurses, physicians, and personnel. Third, critically ill patients and their families often do not want to transfer. Traveling for an hour or longer can be a cruel hardship. Fourth, many times there are no transfer beds available. This was a critical problem during the COVID epidemic. According to the Healthcare Resources and Service Administration Rural Health Program, 92% of small rural hospitals in the Northeast, with 51 to 99 beds, like Sharon Hospital, have ICUs. Most of the ICUs function with internists and cardiologists without intensivists, as we have done it successfully at Sharon Hospital. PCUs usually function as an ICU step-down unit. Sharon Hospital now has a PCU instead of an ICU. Northwell has promised to return ICU level of care to Sharon Hospital by fully complying with all 19 stipulations in the agreed settlement made between OHS and Nuvance when they eliminated the Sharon Hospital ICU and replaced it with the PCU. This includes ensuring that the nationally recognized nursing staffing ratios are met. Critically ill patients must be constantly monitored, both visually and with hard wires for blood pressure, heart rhythm, and oxygen level. Northwell has promised to expand monitoring capability to the entire PCU. If Northwell follows through on these promises, there will be once again adequate monitor beds and appropriate staffing, leading to fewer patients needing transfer. Also, it's imperative for Northwell to keep its promises to recruit many primary care physicians, medical subspecialists, and surgeons that have left Sharon Hospital in the past several years. Patients should not have to travel long distances to obtain specialty care. Telemedicine kiosks are not adequate substitutes. In addition, patients do not have to be transferred for routine surgical procedures that can easily be handled at Sharon Hospital with adequate staffing. Northwell needs to follow through with its commitments it made to Sharon Hospital in its letter dated October 22nd, 2024. And if the pledges are included in the final settlement, I would support the proposed affiliation of Nuvance and Northwell. Furthermore, after being disappointed in prior settlements with OHS, the agreement should have strong enforcement measures. In the past, the monitor has not enforced compliance. In conclusion, I appreciate the scrutiny OHS is giving this affiliation. I greatly appreciate the time and effort Northwell has already made to this and trying to understand the healthcare needs of our community. I think Northwell would be a good fit for our hospital.
Thank you, Dr. Kirsch. That concludes our presentation.
So I do want to take a break. Attorney Jensen, when we come back from the break, I'll ask whether you want to conduct any cross-examination or if you, let's just address that when we come back from the break. Let's take, let's say, till 11:15. Let's take about a 15-minute break until 11:15. Reminder to the public, if you want to sign up to make a comment, you can do that through the Zoom chat function, or you can do that in person here. And to everybody in the room, we're going to turn the recording off again, but your voice and your appearances will likely still be on camera. So just be cognizant of that in any conversations that you have in here. Welcome back, everybody. This is the CON hearing for docket number 24-32717-CON regarding Northwell Health and Nuvance Health's proposed affiliation. It constitutes a transfer of ownership for the hospitals and a group practice. Earlier, we heard the case in chief from the applicants and the intervener. And before we broke, I advised that I would ask the applicants whether they plan to conduct any cross-examination of the intervener. So I will ask Attorney Jensen, do you plan to conduct any cross-examination of the interveners?
We do not. Thank you, Attorney Chuka.
Thank you. Just going over what the plan is for the next couple hours. We're going to do some questioning from now until noon. Then we're going to break from noon until 1 o'clock. We will come back at 1 o'clock and we'll take public comment, and then we will return to our questions. Are there any other housekeeping matters that have come up in the past 20 minutes that need to be addressed?
No, just in terms of the questions, if you would direct them to us as opposed to an individual, but maybe if you wouldn't mind directing them to the applicants, and then we'll be in the best position to determine who can respond, so we can have a good, robust response on the record for you.
Okay.
As opposed to individual witnesses, if you don't mind.
I will do my very best, as will everyone else up here. It's probably going to be sort of conversational in some ways, so we may
Great.
not know who to direct it to. It'll just sort of be a question that we open to the floor, and whoever you think is best
Thank
suited to
you.
answer that.
Appreciate
can
it.
do that. So the first set of questions that we have are along the lines of, how is the deal structured, and what is the structure of the deal here? And again, I know you've put a lot of this into the application materials, and I'm sorry to have to, ask questions that I'm sure you felt you've answered already, but to some extent, this is for the benefit of the public as well, in addition to our understanding. So the first question I have is, please, and this is probably best addressed by Northwell, please describe the structure of the affiliation in very plain language with a clear description of the pre-affiliation and post-affiliation structure of the organizations.
Sure, we're gonna have Larry Kramer. He's an attorney, so he doesn't need to get sworn in. If that's okay. Sure, why don't you come sit right here, Larry?
I think to the extent that he is going to be supplying witness testimony, though, we're still going to have to swear him in.
Sure, fine.
I apologize, but I just want to cover our bases. So Attorney Kramer, can you please raise your right hand? Let me find the prompt. You would think I'd have this memorized by now, but.
Yeah, I'm taking a rest.
All right, please raise your right hand.
Sure.
Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you provided, that the evidence that you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
Okay.
I'm Larry Kramer. I'm the Chief Legal Officer for Northwell Health. Kramer is Kraemer. And so the description of the proposed organizational structure is a very simple one. We've established a new parent corporation, Northwell Inc., which will be the ultimate parent for both the Northwell side and the Nuvance side. We've established a second company called Northwell HS Inc. HS will ultimately be named Northwell Health System Inc. That Northwell Health System Inc. will become the member the corporate member of Nuvance Health. Northwell Inc. is the corporate member of Northwell HS Inc. So we've added two boxes at the top, one super parent and one be the member of HS be the member of Nuvance Health. So it's a very simple boxes for the corporations. We're also going to put in place a system where we have an overlapping board. So the board of Nuvance, HealthQuest, Western Connecticut, and each of the hospitals will be the same individuals. It will be composed of the 18 members who are from the existing Nuvance boards, plus 6 members appointed by Northwell Health and the CEO from Northwell Health. So it'll be a new 25-member board to be a mirror board, with the same board of all of the Nuvance entities. It's a structure we use on the Northwell side. We have quite a few hospitals and corporations. By having the same individuals serve as the members of each of the boards, we enhance, as Dr. Silva talked about, systemness. And by having the same individuals serve on those boards, we can enhance an overall corporate vision and corporate view. We also, though, have local community advisory boards. And those boards are the individuals, in the case of Nuvance, the individuals who have been serving on those local community. Life is not going to change much for them. They're going to have the same meetings, get the same level of information, get the same insight. We hope that those members of those boards who become community advisory boards will continue to be the ambassadors for the local hospital in the community, be the voice of the community and the voice of the hospital to the community to continue to serve in that role. But we're going to continue to give them the same financial information they've always gotten, the same operational information they've always gotten, the same quality control information. So they are still going to be receiving the same information flow, but we're asking them to be our health system, eyes and ears, to be the voice of the community, but also to engage in philanthropic efforts on behalf of the local hospital, where that for philanthropy, for monies raised, will be used there locally, and for also to work in that regard. We're also going to have them still be in very much a voice in quality issues, physician credentialing, things like that.
Thank you. Do the joint members of Northwell and Nuvance, do they serve in perpetuity?
No, they'll be subject to elections on a periodic basis. I could check the affiliation agreement where it is. We typically put them in classes of 3 years. So you always have a 2/3 of the board is the same from year to year.
Okay. And do the other Northwell member hospitals have similar board affiliations?
Yes.
Compositions?
Mhm.
Okay. So
I
what?
would mention this is for a 5-year phase-in, which is what we've done in all of the hospitals. There's a 5-year phase-in period. At the end of the 5 years, it'll be the same board for all of the Northwell and Nuvance entities.
Okay. So I'm glad you brought up the 5-year phase-in period.
Mhm.
What happens after the 5 years?
Well, after the 5 years, we seek to have a mirror board from all the Northwell entities and the Nuvance entities. Would be the same folks, so the same individuals will serve on those boards. We're also adding 6 members from the Nuvance side to the Northwell board. So the Northwell boards will actually have a 6 members brought up from the Nuvance side.
So it sounds like Nuvance will continue to exist after the 5 years. Is that-
Yes.
Okay.
Thank you. Can you say a little bit more about after the conclusion of this 5-year period?
Mhm.
How will Northwell ensure representation from the communities, the Connecticut communities, which have Nuvance hospitals on the Northwell board. So as I understand it, please correct me if I'm wrong, there'll be a single, essentially a single board for all of the Northwell hospital affiliates.
Mhm.
And that will be a 25-member board with the 6 new members from,
Well,
Nuvance.
actually, the Northwell Board has 36 to 38 members.
okay. And
So-
will there be 6 additional with the?
Yes.
So a 42-person board,
Roughly.
roughly. And how will Northwell ensure representation from the local Connecticut communities
Well,
on that board?
once people become members of the board, they become members of the overall Northwell board. Northwell seeks in its board to get the finest quality individuals that they can to represent the system and to look at for the entire geographic footprint. And so I would imagine that that will always be in top of mind when we're looking to add members.
Switching gears a little bit. The 5-year capital commitment table that has been included in some of the pre-file submissions, there's a footnote that says,
Do you mind letting us know what page
Sure.
that's on?
it was in slide 19 of Northwell's presentation, as well as NH 9330 of Exhibit D. The easiest place to get to it is probably slide 19 of the presentation. So
I have it.
there's a footnote that is included there that says, assumes that Nuvance Health's operating income losses do not exceed 300 million in any consecutive 12-month period. So what happens if it does exceed the 300 million in any 12-month period? And I for reference, I'm thinking of like the COVID pandemic or, some other emergency situation like that coming up.
So that footnote is there to give us the assurance that we can move the money around to redirect towards operations, to make certain that we focus first and foremost on the stabilization of the institution. So the commitment is there of the 1 billion, but we would move the money around probably to base capital operations if necessary.
I don't think that's appropriate, I'm sorry. It's not in order. I'm sorry. It's OHS that's asking the question.
Is it like a logistical concern of some kind?
Oh, okay, sorry.
Dr. Morgan has patients that he has to get back to. So if possible, to ask him any questions before 12, then so we can leave at 12, that would be.
Okay, thank you. I'm not aware of any questions that we have for Dr. Mortman. Yeah, I think he can leave.
Thank you, Doctor.
So starting at the same Bates page number that I provided a minute ago, NH 9330. The applicants state that, quote, no sooner than 5 years following the affiliation, Nuvance achieve break-even performance for operating margin and cash flow. So the question that follows from that is,
Can you just give us a moment to
Sure.
get to that page?
so that's NH 9330 of Exhibit DD. And it's also located at NH 9193 of Exhibit EE, as in elephant.
Thank you.
You could take a minute to
Appreciate it.
familiarize yourself with that.
It's a big
I'm
book.
surprised you don't have 10,000 pages memorized at this point. but-
Sorry about that. And the question is?
How long, and actually this might be better directed to Nuvance, how long can Nuvance quote unquote like last if the break-even performance for operating margin and cash flow takes longer than expected? Like, is there a deadline in which this break-even must happen in order to be successful?
I feel comfortable taking that question. If you look at our history, each individual institution is different. The circumstances around the institution is different with regard to its ability to break even or to be accretive to the whole. And we take that into account. We have organizations, we have institutions within Northwell that we never expect to break even. For example, our South Oaks Hospital is a behavioral health hospital. It loses on the order of how much a year? Where is she? $15-20 million a year. Our Zucker Hillside Campus Hospital loses on the order of $45 million a year. That is part of our mission, and we absorb those losses into the whole. If a Nuvance hospital finds itself into that condition, we will continue to absorb those losses into the whole of Northwell. We have never closed a hospital, and we don't intend to.
Thank you. And this may be better directed to the attorneys, but have you supplied a complete list of affiliates and subsidiaries in connection with this application?
Yes, for the Connecticut entities we have.
Are any of Nuvance Health's affiliates for-profit entities?
I'll defer to Attorney Jensen.
We could probably best address that through Brian Wyatt, Chief Legal Officer for Nuvance Health. If you want to swear him in, Attorney Chuka.
Sure. Please raise your right hand. Actually, before I do, yeah, we can do that. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence that you shall provide shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
And can you just spell your last name and your title again?
Sure. So it's Brian Wyatt, W-Y-A-T-T, and I'm the Chief Legal Officer at Nuvance Health.
Thank you.
You have the mic on over there? Yep.
I'll move it a little closer.
Thank you.
So the question is, does Nuvance have any subsidiary for-profit entities?
Yes, so Nuvance Health currently has one subsidiary that is a for-profit entity. It's called SWC Corp. It operates the retail pharmacy in the lobby of Norwalk Hospital. It's been in place, I think, since the early 1980s, I believe. That is the only operation really that entity has. Everything else that's within our wholly owned subsidiaries in our system are not-for-profits. We do also have ownership interests in several ambulatory surgery centers, which operate as for-profit entities. But again, those are not wholly, those are minority interests for the most part. Anything though that we either wholly own or control other than SWC are not-for-profit tax exempt entities.
And I was about to ask, have you provided a list of those subsidiary entities that you just mentioned? Your knowledge?
Yeah. So in the affiliation agreement, so it's NH 0311, it's an exhibit to the affiliation agreement. So when we were working through the affiliation agreement with Northwell, we had to obviously disclose to them all of the, the full list of affiliated entities that we have within Nuvance Health, which include a number of entities that operate only in New York State, as well as, of course, all the Connecticut entities.
Okay, thank you. I believe Attorney Jackson has some follow-up questions for you.
On NH 0206, that's Exhibit 4 to the application, the Nuvance Health current organizational structure with subsidiaries. Could you point us to the for-profit affiliate in this organization structure? Just so that we can identify it.
So this organization structure doesn't show that in any, it actually only shows our or really our licensed entities that operate hospitals or ambulatory surgery centers, as well as our medical practice entities on the Connecticut side. So there are other affiliated entities, for example, charitable foundations that we have that are associated with our hospitals that aren't shown here as well, because those, and I believe that's because they're not part of the CON process. We certainly can provide a full table of organization if that would be helpful.
We can discuss that. I think we may ask for that as a late file. Speaking specifically to SWC, how do the profits and losses of that affiliate affect the overall finances of Nuvance Health and its hospitals?
So I think I may defer to Dan on that from a financial perspective, but I will say just up front that it's a small operation. Again, it's a retail pharmacy in the lobby of Norwalk Hospital, so it's only serving either patients of Norwalk Hospital who want to get their prescriptions filled before they're discharged, or people who walk in off the street. As you might imagine, not a lot of people walk in off the street to a hospital to get a prescription filled. Most of those folks go to a CVS or Rite Aid or wherever else. So I think, in terms of total financial impact, it's probably pretty small, but I would defer to Dan on that.
Mr. DeBarbara, you can come up.
I mean, it's fairly immaterial to our operation. We lost $1.4 million last year on our SWC pharmacy. It is fairly immaterial to our overall operation. We lost $1.4 million from operations in our SWC pharmacy last year. We have had years we have a small profit, but again, it's largely immaterial and it rolls up to our corporate parent.
Okay, thank you. So I'll turn to Northwell and ask similar questions. Do you have any for-profit entities as subsidiaries?
I'll start and then I'll ask Larry to come up as well. We have numerous for-profit entities. All of them exist for the sole purpose of actually making money to throw back into our margin to support our mission and our efforts with regard to community benefit programs that we serve. And Larry, do you want to give an overview of the?
I would just add that we have no Connecticut for-profit.
Okay. And that was, forgive me, I forgot your name. Larry Kramer, the general counsel. So how do the profits and losses of those affiliate entities affect their overall finances? I think you just spoke to that, Mr. Salazzo, but do you have any additional comments?
No, once again, the sole aim of going into those for-profit entities is to have them make money to support the mission. So it rolls up into our overall finances overall at the parent level.
Okay.
So if the for-profit entity is not profitable, so it's not, is it under the direct control of the Northwell board?
It is under the direct control of the Northwell board.
Okay. And if the for-profit entities are not profitable, those losses also, so both the profit and loss impact the corporate parent?
They do, but by nature of this line of business, if the for-profit entity is not profitable, we get out of the business immediately. The sole purpose is to try to support the mission of the organization.
So the intention, and this may, thank you. This may come up in other questions, lines of questioning, but is it your intention to establish for-profit entities in Connecticut as part of this program?
Question. Co-health.
No, I'll let.
Yeah. Okay, so there is one for-profit entity that is a joint venture right now between Northwell and Nuvance and Go Health Corporation. I believe it was in front of your agency most recently where we got approval to identify 3 additional urgent care sites in this joint venture. Other than that, we have no plans at this time.
Thank you.
You're welcome.
I think this goes without saying, given some prior comments you made, but will any of Nuvance Health affiliates that will be acquired be converted into for-profit status?
No.
Thank you. So sorry to go backwards a little bit, but the Nuvance board stays intact, but with the addition of a few members that serve on both the Nuvance and the Northwell board simultaneously. Does that mean that the current Nuvance board generally maintains most control over the Nuvance hospitals post-acquisition?
Yes, post-acquisition, there'll be a 25-member board for each of the hospitals and the Nuvance Health and the Health Quest in Western Connecticut. It'll be all the same 25 individuals, 18 of whom are predecessor Nuvance board members. Oh, the duties are the same, yes.
Okay.
Can I clarify, Mr. Kramer? I think there are certain threshold positions that would go up to the Northwell board during this transition period. Am I correct? That there are certain specified?
Yeah, there's certain oversight things.
Yeah. Sorry, we should get you a seat at the
Yeah, I
at the
think so.
table, Mr. Kramer.
That's okay. Yeah, let me change that.
We have a hand mic here. I don't know if that would be helpful. You could just pass that around.
There are certain matters which need to be approved by the parent boards. That's correct. Much like the Nuvance hospitals operate now, where certain matters are approved at the hospital board and then go up to the Nuvance board for approval there.
Thank you.
So in various locations in the materials, the phrase certain, or the Northwell board will have certain authority over Nuvance Health's day-to-day operations. Can you please describe what exactly that means? With some examples, if possible.
Some example of the day-to-day operations, there'll be such things as approval of capital and operating budget items.
So these next questions are going to deal more with sort of turning around Nuvance as an institution. Throughout the application materials, the applicants represent that Nuvance is experiencing significant financial challenges. Can you provide any more details than you have already given today regarding Northwell's plan to sort of right the ship, so to speak.
You want to take? Sure. So what we do is first and foremost, which we've already been doing, is make certain that we assimilate cultures, because we want to make certain that there's everyone is sort of like moving in the same direction. So the town hall meetings that we've had, the integration meetings that John and I have been chairing with regard to different work streams on looking at different areas to prioritize. We'll focus on, let me just get to a page if I could. I think would be helpful. I don't know where it is. I'll just talk from the top of my head. We focus on different areas. For example, one area that we know that Nuvance is experiencing some difficulty in is in staff turnover. And so we're going to spend a lot of time focusing with our Nuvance partners on engagement, bringing some of the tools that we have with regard to, thank you, some of the tools that we have with regard to trying to minimize staff turnover. A 1%, we have turnover at the rate about half of what Nuvance currently is experiencing. And so they're able to bring people in, and unfortunately, the turnover is still significant. If we're able to reduce that down to the level that we have, that's about a 4% reduction, which could be which is hundreds of staff retained. So that's one area. We will look at outsourced contracts. So unfortunately, because of the turnover right now, they have to use premium dollars. We have created an internal flex staff agency, which actually provides services to our own hospitals at cost instead of a markup on premium when you go to outside agencies. With regard to purchasing, we have our own GPO, group purchasing organization. Our supply costs as a percent of revenue are at the 90th percentile for healthcare. That's a good thing, not a bad thing, the 90th percentile. So we will look at where the opportunities are to work together, honoring all existing contracts. On the revenue side, and I know that some of this work is being done by Nuvance already, is on everything. When they provide service, we want to make certain that they get paid for the services that are provided. So we will look at improving revenue cycle processes as well. What am I leaving out? There's a whole range of different things. At our shared services level, we have the luxury, because of how we've grown, to be able to have a very robust shared services in finance, in IT, in technology, in real estate, across the full gamut of back office functions. We'll look at where there's opportunity to do things together in a more efficient way as well.
Thank you. It has been stated earlier in testimony that Nuvance Health reported a 99 million deficit in fiscal year 2024. For clarification, is that all of Nuvance, including New York, or is that just Connecticut specifically?
No, should that be the end of our?
Yeah, it's the entire system, New York included.
And what are the primary drivers of that loss?
Well, maybe I'll answer the question differently. Last year, the year before, we lost $163 million. And what did we do to improve that? Many of the items that Mr. Slauso mentioned, we've already started. So we had revenue cycle improvements. We made changes to our supply chain, got less expensive pricing. We had some modest volume increases. We worked very hard at it, recruiting new physicians. And so with that, that helped improve our bottom line. We made some pharmacy improvements, and that all added up to about $76 million of improvement. So that took us from the 163 down to the 99, give or take a few other happenings throughout the year. But I think that the loss, what's driving the loss are all the environmental, healthcare environmental concerns that John mentioned earlier. He was referring to sort of the post-COVID employer, what's the word, labor market, a difficult labor market, and high inflation, weight loss drugs, high costs associated with our employees. I mean, all of those items are driving our loss. And certain hospitals, Sharon, Putnam, because we're talking, the number I gave you was our system-wide, where there's not a tremendous population in that area. And it's hard to find new patients. We have to work, it'll take some time. And for a health system of our size, bearing those losses becomes a real burden. And it appears that, Northwell has more time to deal with some of those issues and put some of the improvements in place that Mr. Salasso outlined.
And do you have a sense of how the losses are divided between New York and Connecticut, the 99 million?
Yeah, this past year, the New York hospitals were collectively more favorable than the Connecticut hospitals. I don't recall the exact number. Do you have it, Jen? Yeah, the vast majority of the losses, combined with the losses in our physician practices, generated that. The Connecticut losses plus the physician practices associated with the Connecticut hospitals generated the majority of the $99 million loss in this past year.
I think it would be helpful for us to know the specific breakdown that you just described in terms of, first of all, hospital versus physician group and Connecticut versus New York.
Sure. We have our unaudited internal financial statements, which break all that out, which we could easily provide to this organization.
Thank you.
So we will add that as a late file.
And Attorney Chuka, just to be clear on that, as Mr. DeBarba just mentioned, those are unaudited. They are not final. They're subject to further as the audit process concludes. Just want to make sure that's clear in the late file order. Thank you.
I believe this has been addressed to some extent earlier. The applicants state that the focus of the initial strategy for the affiliated system will be to reduce operating losses for Nuvance over a 5-year period. What are the low-hanging fruit, so to speak, for Northwell to try to fix as quickly as possible?
Yeah, I think I addressed most of that before. I'll just give another example since I finally found the page I was looking for. We've had the luxury of being able to create certain kinds of programs throughout our system, such as what we call the round robin program for blood loss. We're able to move product around amongst our hospitals. And that's just one example of a way to minimize loss and reduce cost of care. We would bring programs such as that up to our partners in Nuvance.
Okay. I know this has been stated in the application materials before, but I just wanted the public to hear it from you. You have represented that you do not intend to close or reduce any services to reduce costs. Is that correct?
Yes, it is.
Thank you. I know we asked a couple questions about this in the in somewhere along the line. So you have never closed or sold a hospital. Have you ever sort of rebranded a hospital? And I'm specifically referring as an example to where Yale through Bridgeport Hospital acquired Milford Hospital and then sort of shifted Milford Hospital into a different type of hospital. I think it's an inpatient rehab facility of some kind.
Trying to give you the mic. Yes, we've done that continuously in our history, working with the local community, trying to understand the needs of the local community, filling clinical gaps, working with the providers, trying to understand what programs could be grown in different community. Sometimes working with different communities, we've moved services from one community to another that might be more beneficial because of a central location. So we have done that amongst our community hospitals, back and forth, always with community involvement and provider involvement. You know, I'm sorry. I was
Let
going
me
to
just add that, we've had, one hospital where with two hospital sites not be close to one another, Syosset, Plainview, where we readapted Syosset, kept it open, expanded services there, but moved services from that place to the other place because it was more conducive for the local community, easier to transport. Southside Hospital, which Mark mentioned earlier, was a community hospital in dire straits that nobody really thought years ago that it would ever have the possibility of being productive or saved. Yet we took it over and has converted it now to a tertiary campus. So it is a growing, fast growing, very successful tertiary campus. We did change the name from Southside Hospital to South Shore University Hospital because the Southside name had a sense of negativity attached to it, and we wanted to change the way we branded it. So that facility today is a robust facility providing comprehensive services to the community and a major tertiary campus. But expanding services in that community consistent with what the community needs. And that took in each of these cases, major involvement with local community representatives and advocates and local community board members that were once a board of the hospital, but then became advisory boards and became very active in actually helping to raise money in that local hospital, especially at Southside.
And just to note on that one as well, the impact on the local community, I mentioned it was a depressed community when we started our journey with regard to South Shore. That is a booming community now with a lot of growth. And so we also want to emphasize the connection between a stable, growing healthcare institution and the effect on the local economy is always positive.
And I just want to reiterate that we have never walked away from the facility. We have in all cases over our history improved the facility and expanded services.
Thank you. I am mindful of the fact that it is now a couple minutes after noon, and I said we would break at noon. It's not ideal for us to sort of stop this line of communications, but I want to make sure that everybody has an opportunity to get some food in their stomach. So we are going to take a break now from noon until 1 o'clock. As I mentioned earlier, we will have public comment at 1 o'clock. And if you plan to remain in this room, just be mindful again of the fact that we will have the AV running even though we will not be recording. So any conversations you have might be picked up. Welcome back. For those just joining us, this is the second component of today's hearing regarding Northwell Health and Nuvance Health's application, which bears docket number 24-32717-CON. The applicants are seeking a certificate of need for the transfer of ownership of a healthcare facility pursuant to Connecticut General Statutes, Section 19A-638A. 2 and a transfer of a group practice pursuant to 19A 638 sub A sub 3. We had the technical portion, well, we had much of the technical portion this morning, and we're now ready for public comment. As I indicated earlier, sign up for public comment began at 9 a.m. and has been in person and on the Zoom comments section. If you have not done so, please sign up now because we will be closing the comment section in a moment. The order of comment will be as follows, although some exceptions may be made. First, we'll take elected and appointed officials and representatives. Second, we will take the applicant's clinical professionals and executives. Third will be other clinical professionals and executives. Fourth will be individuals the applicant signed up in advance of the hearing. And fifth will be other members of the public. Since we need to ensure some order between those who signed up in person and those who signed up via Zoom, I'm going to start first with those who signed up in person and then move on to those who signed up electronically, with one exception. So we will call the names of those who have signed up to speak in the order in which they are registered. We will be unmuting each person one by one if they are in the Zoom chat. Speaking time generally is, speaking time is limited to 3 minutes for members of the general public. And Maria Horn, Representative Maria Horn, is with us, and she'll have some flexibility to go beyond the 3 minutes. Additionally, we strongly encourage you and anyone else listening to submit any further written comments to OHS by email or mail no later than 1 week. That is 7 calendar days from either today or the second date of the hearing, whichever occurs later. The email address again is concomment@ct.gov. Our contact information is also on the website and on the public information sheet that is available over by Faye. Thank you for taking the time to be here today and for your cooperation. I'd ask that you please try to the best of your abilities to limit duplication of comment. To give you a sense of how long you should expect public comment to last, we have currently 23 individuals who have signed up. So at 3 minutes apiece, that's at least an hour. We are now ready to hear some statements from the public. Again, Faye Fentis from our office will read off 3 names at a time. Please be prepared to speak when it is your turn. Anyone speaking remotely, I would remind you to turn on your video and your microphone. So we're going to begin with Representative Maria Horn. She is already up on the screen. Thank you for attending today, and you can feel free to begin whenever you're ready.
Thank you. And so I am State Representative Maria Horn. I represent the 64th District, which includes 9 towns in the northwest corner. And I thank you for holding this hearing and for giving me the opportunity to share my testimony with you. I am here to express my support for the proposed affiliation between Nuvance Health and Northwell Health, to ask that you approve that affiliation, and to make a specific request that in that approval you incorporate a particular letter of commitments that Northwell wrote to a community organization in October. I am here again because I represent Sharon. Sharon is one of my towns where Sharon Hospital is located. My district is rural. It is, lacking in transportation options and healthcare options, and much of the constituents I represent are dependent on, highly dependent on the services of Sharon Hospital. So it's very important to us for, obvious reasons. I do believe that this affiliation is in the best interest of my constituents as well as others in the state. For a couple of reasons. One is Northwell's demonstrated record of investment in community hospitals and enabling them to thrive, some of them in quite difficult conditions when Northwell came in. It is an impressive record and an experience that is highly relevant to ensuring the survival of a hospital like Sharon Hospital. And two is the approach that Northwell has already taken to beginning this communication, this conversation with the community and the affiliation, which is to say specifically its engagement with the community, which has really been substantive, thoughtful, not hiding the challenges that lie ahead, but listening to the concerns of the community and acknowledging the important work that a lot of community advocates have put in here, highly thoughtful, educated, informed, balanced work that represents the community's desire for the hospital to survive and thrive. We have been in our community. Sharon Hospital is a small hospital. It's been part of several different affiliations in the past. And in the course of those last, couple sets of health systems, several approaches have been made to OHS for your approval for other things. And that approval has been granted to both Nuvance and HealthQuest, the predecessor to Nuvance, for the proposals that these health systems have brought to you, but they have been conditioned upon the continuation of specific services at the hospital for specified periods of time. And sadly, those commitments have been repeatedly broken. We have been let down. They have not kept those services. They have announced intention to close down labor and delivery in particular. They have approached OHS for permission to shut it down. Now OHS denied that, but nonetheless, in the wake of that denial, there has been a marked lack of support for maternity and labor and delivery in particular. So for that reason, we really would like you, in your approval, which again, I strongly support the affiliation proposed here, but that you include this specific letter that Northwell wrote to a community organization in October. And that letter was written in response to having met with the community several times. It really, and Northwell, again, I want to thank them. This is not because we don't support Northwell. We think we're very optimistic for their ability to help us. But they made specific and binding commitments in this letter and delineated a series of immediate actions to be taken. And I think it'll be really helpful and give great comfort to our community that they're really serious about maintaining these services going forward. So for that reason, we ask that letter be part of any agreed settlement. There are lots of challenges to health systems in Connecticut, as I know OHS knows better than anyone, and certainly to rural hospitals across the country. Much has been written about that. I am really hopeful that the two applicants here are going to be well positioned to address some of our challenges, and I really look forward to being part of that solution with the community behind all of us. So thank you again for allowing me to be here remotely on a busy day. and I know you have many other people to listen to, so thank you.
Thank you,
Thank you,
Representative, for being here.
Attorneys Volpe and Jensen, did you have any clinical professionals or executives who you wanted to speak sort of out of turn now, who need to get back to whatever it is they're doing, or should we just proceed in the order?
This is Ben Jensen. Yes, my understanding is we do have physicians on the line remotely who would, if we could move them to the front of the line, that would be great.
Sure. I could use your assistance in identifying who those are.
I know, that was the next question.
I have Dr. Jeremy Levin.
Dr. Orlinick is on the line. Dr. Orlinick.
Dr. Orlinick, is he with us?
Thank you. Can you hear me?
Yes.
Great. Thank you very much. I appreciate it. Good afternoon, Commissioner Gifford and the OHS staff. My name is Jason Orlinick, and I'm here to speak in support of the planned affiliation between Nuvance Health and Northwell Health. I'm a resident of Fairfield County, Connecticut. I live in Fairfield, Connecticut, where I've been for about 20 years. I've been at Norwalk Hospital for that period of time. And I'm currently the Vice President of Medical Affairs and the Chair of Medicine at Norwalk. And as you know, our hospital serves Lower Fairfield County. We have a lot of hospitals around us. It's a very competitive area. As such, I'm very interested in this hospital and the communities around us. And as a physician leader, I support the affiliation because I think it will better serve our patients and our community. I know our patients want a thriving local hospital that will care for them day and night, irrespective of their residency status or ability to pay. Nuvance Health has a long history of working closely with its community partners to deliver compassionate healthcare and high-quality healthcare to anyone needing assistance. I appreciate that Nuvance Health's mission is closely aligned with Northwell Health's mission. We are both about physician wellness and engagement. Their medical and nursing education programs are very well known, as are our medical education programs. Culturally, we are, I would say, a perfect fit. And I very much look forward to the opportunity to continue to deliver the great care our employee and our non-employed physicians and nurses and entire team strive for. I'm impressed by Northwell's commitment to the community and the special initiatives they have underway. Many of these initiatives, like their work in mental health, are closely aligned with our efforts. With increased capacity to invest in medical advancements and innovation, the integrated system would better serve patients in their respective markets and communities. Their model of not adhering to a hub and spoke model also resonates with us down in Norwalk. When Nuvance Health does join Northwell, local communities will have access to coordinated care across Western Connecticut, the Hudson Valley, New York City, and Long Island. The care delivered in these sites would span the full range of ambulatory, hospital, and post-acute care services. I feel that the planned investment in our hospitals and communities is welcome and beneficial to our collective sustainability and progress towards improved healthcare for our region. The shared knowledge, resources, and investments will strengthen medical care in Western Connecticut. I respectfully request that OHS approve this application. Thank you for your consideration and the opportunity to speak with you today.
Thank you, Doctor.
And the
Attorney
next,
Jackson.
is there a Dr. Marshall?
Dr. Marshall, are you with us? I don't see him on our list. Oh, okay. Can you hear us, Dr. Marshall?
I can. Thank you. Can you hear me?
Yes.
Excellent. Thank you so much. So good afternoon, Dr. Gifford and the members of the Office of Health Strategy. My name is Dr. Mark Marshall. I am a physician practicing internal medicine and palliative medicine at Sharon Hospital. I've been a local resident and a practicing physician here for about 25 years. I'm also Vice President of Medical Affairs at Sharon Hospital, and I'm the System Chair for Nuvance Health for Palliative Medicine. And I wish to voice my support today for the proposed affiliation of Northwell and Nuvance Health. I believe that this affiliation will benefit Nuvance Health and Sharon Hospital specifically, as it will expand the breadth and depth of services that we provide by focusing on the needs of our community, by supporting recruitment and investing in new technologies. Northwell has demonstrated a commitment to community health, addressing disparities and health inequities. This affiliation brings together two like-minded community hospital systems to deliver excellent care close to home. In the recent weeks, we've gotten to know the leadership team of Northwell to some degree, and we find them very compatible with our vision for the care that we want to provide for our communities. So I hope you will approve this important application. Thank you.
Thank you, Dr. Marshall. Attorney Jensen?
So Dr. Jeremy Levin?
Dr. Levin, are you with us?
Thank you very much for, can you hear me?
Yes.
Good afternoon, Commissioner Gifford and the OHS staff. Thank you for having me with you today. My name is Jeremy Levin, and I'm here in strong support of the planned affiliation between Nuvance Health and Northwell Health. I've lived in New Milford, Connecticut for 37 years, where I live on and operate a farm. I'm born and raised in a rural setting, and I understand the unique challenges patients face in these communities. As a medical doctor who's worked in leading hospitals, both in the United States and around the world, I know firsthand the importance of high-quality healthcare in both well-served and underserved areas. I also led the world's largest generic drug manufacturer, which provided 1 in 6 pills taken in the United States. This gave me a unique view of healthcare from both the provider and industry perspective. In both roles, I deeply appreciate the need for high-quality, accessible care in every community. My connection to Nuvance Health is also personal. 35 years ago, I rushed my wife to the local emergency room where she went into preterm labor. Our daughter from their pregnancy is now a healthy 34-year-old. I've also been a patient at Nuvance myself, treated there for various injuries incurred on my farm. Now I've moved my primary care to Nuvance and experienced the high standards of the clinics and doctors serving our region. This partnership between Nuvance and Northwell isn't just about sustaining healthcare. It's about expanding and improving it. Northwell brings critical resources and a proactive approach to community care, with numerous initiatives already underway. I am certain that with their financial support, expertise, and innovative mindset, this affiliation will improve healthcare across our region. Most important, it matters medically. The data on healthcare access is quite clear. Distance matters. The further a patient from a high quality care center, the higher the risk of adverse outcomes. For all of us in Western Connecticut, this affiliation will help keep life-saving care close to home and community care. This partnership will also support our healthcare needs and boost the local economy, creating jobs, enhancing community well-being. Nuvance's commitment and compassionate to accessible healthcare aligns well with Northwell's values, making this affiliation a very positive step forward. Lastly, I heard discussions this morning about Nuvance's operating losses and how Northwell would address them. Very interesting and compelling. Beyond that, though, Northwell's responses, beyond their responses, I'd add that this merger prospect encourages additional philanthropic support as it has with us. I strongly encourage OHS to approve this application. In my opinion, the future of quality healthcare in Western Connecticut depends very much on it. And thank you very much for the time and your consideration.
Then if we could hear from Matt Casavecchia, who's the Director of EMS for Nuvance.
Good afternoon. Can you hear me?
Yes.
Okay, well, thank you so much for having me. My name is Matthew Casavecchia, and I'm the Director of Emergency Medical Services for the Danbury Hospital. I've been employed with the organization for 34 years, and I enthusiastically support the proposed affiliation of Nuvance Health and Northwell Health. This affiliation brings together two like-minded community hospital systems that embrace the importance of pre-hospital care, emergency management, and the continuity of operation planning activities as essential functions to meet the needs of our patients. Now more than ever, healthcare institutions must continually assess and respond to hazards and vulnerabilities that, if left unchecked, will impede critical life-saving measures. Sharing of best practices from individual experiences, lessons learned from high-impact events, and the pooling of vital resources will create a strong network of assets to come together in a time of need while developing a culture of preparedness. Disasters, as we know, come in many forms and often are unpredictable, but a well-prepared affiliation of healthcare institutions can successfully mitigate such risks to ensure high-quality care is carried out in the most trying of circumstances. Adopting strategies to further support healthcare as critical infrastructure will best position the community to respond and recover in a meaningful and timely way. Nuvance Health was there for the state and its communities during the COVID-19 crisis, and we need to make sure that we are there in the future. This partnership with Northwell will undoubtedly help do so. Thank you for your time. I hope that you will support and approve this important application.
Thank you, Mr. Casavecchia.
Then if Michelle James is on.
I am on.
And we can hear you. So whenever you're ready.
Great. Thank you. I am Michelle James. I am here to speak in support of the planned affiliation between Nuvance Health and Northwell Health. I have lived and worked in Danbury for over 30 years. I am currently the Executive Director of the Community Action Agency of Western Connecticut. Our service area encompasses the 25 towns in Western Connecticut within the Nuvance service area. I support this affiliation application because the sustainability of high-quality healthcare is important to me, my clients, and my stakeholders. I appreciate the organization's mission and is closely aligned with Nuvance's mission, and I believe Northwell's too. I'm impressed that Northwell's commitment to the community and the many initiatives that they have underway. I feel that the planned investment in our hospitals and communities is welcomed and beneficial to our collective sustainability and progress towards improved health for our region. The disparity gap in health outcomes for low-income residents and individuals and families of color is a pressing issue that requires immediate attention. It is a result of systematic issues such as unequal access to quality care due to socioeconomic status, geographic location, provider bias, and language barriers. The complex interplay of socioeconomic barriers, particularly housing instability, significantly contributes to a multitude of health risk factors, including lack of access to medication and care, mental illness, and substance abuse. Combining Nuvance Health with Northwell resources will enable the organizations to meet the evolving, varied needs of local communities more quickly, more efficiently, and more effectively. Together, both organizations would be able to make significant improvements to the health outcomes and address health disparities across the communities that we serve. As nonprofit organizations, Northwell and Nuvance would combine to provide care to anyone regardless of their ability to pay. It is my understanding that the agreement will increase the opportunity to attract and retain top talent, including physicians, nurses, surgical, and resource specialists, as well as allied health and business professionals. By coming together, medical staff and employees would have greater professional growth opportunities, new career prospects, and the chance to work with some of the best in the industry. And this will absolutely transform the life of many in our communities. I urge you to approve this affiliation, and I would like to thank Commissioner Gifford and the OHC staff for this opportunity. Thank you.
Thank you, Ms. James.
Tom Dubin.
We cannot hear you, Mr. Dubin.
It's the panic look, somebody on mute.
Do we want to try one
Okay.
other?
Well, we'll try someone. We'll come back to you.
Rick Cantelli.
Good afternoon. Can you hear me?
Yes, we can.
Good afternoon, Commissioner Gifford and OHS staff. I appreciate the opportunity to talk to you for a few minutes today. I am the board chair at Sharon Hospital, and I have been since its affiliation with HealthQuest. And while I respectfully disagree with Representative Horn's characterization of Nuvance's and Sharon Hospital's fulfillment of the commitments they made, I do agree with her in that I am in support of this affiliation with Northwell Health. I've been a resident of Salisbury, Connecticut for my entire life, and I am providing my comments today based on the perspective as a resident, patient, and a community volunteer. I support this affiliation because a thriving Sharon Hospital and Nuvance Health is critically important to me and our community. As board chair, I recognize the complicated nature of healthcare today and the effects on hospital finances. I applaud Dr. Murphy and my board colleagues for being proactive in terms of preserving the long-term future of Nuvance Health and Sharon Hospital in particular. I believe that Northwell Health is the right partner to ensure that we can continue our work and legacy for many years to come. Nuvance Health has a long history of working closely with its communities and to providing compassionate health care to anyone needing their help despite a person's ability to pay. I believe that this affiliation will strengthen that community benefit in the greater Sharon community. I appreciate that Nuvance Health's mission is closely aligned with Northwell Health's, and that the collective knowledge, financial resources, human capital, and innovative mindset will strengthen access to the highest quality healthcare across our region. I'm also impressed by Northwell's commitment to medical and clinical excellence and recognize that their hospitals, like our own Nuvance hospitals, are the cornerstone of our communities. I feel that a planned investment in our hospitals and the economic benefit to our communities is welcome and will drive sustainability and progress toward improved health for our region. In many ways, my position as board chair has uniquely positioned me to better understand the challenges the Sharon Hospital and Nuvance Health face in the longer term. And I encourage you and urge you to move this application forward to an approval. Thank you for your consideration.
Thank you, Mr. Cantelli.
Karen Gottlieb.
Can you hear me?
Yes.
Okay.
Yes, we can.
Okay, thanks. Good afternoon, Commissioner Gifford and OHS staff. My name is Karen Gottlieb, and I am here to speak in support of the planned affiliation between Nuvance Health and Northwell Health. I live in Stamford and have been executive director of the AmeriCare's Free Clinic since 1994. I'm also a member of the board of directors of the Norwalk Hospital. Today, I am representing the AmeriCare's Free Clinics and the patients we serve. We provide primary health care to low-income uninsured residents, keeping those adults with chronic disease from developing long-term disabilities and worse. Our service area encompasses Fairfield County with clinics in Norwalk, Danbury, Bridgeport, and Stamford, and falls within the Nuvance Health service area. Both Norwalk Hospital and Danbury Hospital have supported our program since 1994 and 1997, respectively. Without their partnership, our patients would not have access to critical diagnostic testing, specialty care, and laboratory testing. Working together, our patients receive quality care that affords them the opportunity to be well and support themselves and their families. I support this affiliation application because the sustainability of high-quality healthcare is important to our patients and donors. Nuvance Health has a long history of working closely with its community and providing compassionate healthcare to patients needing their help despite a person's ability to pay. I am impressed by Northwell's commitment to community and the many initiatives they have underway. Combining the resources of Nuvance Health and Northwell will enhance population health and outcomes for our vulnerable populations. I encourage OHS to approve this application. Thank you for your consideration.
Thank you.
And that was the last name on my list, unless we wanted to try Tom Dubin again. I don't know if the issue is resolved.
Has Mr. Dubin indicated whether he's trying a different method of connection? No, still can't hear you. I'm sorry, Mr. Dubin. You can submit written comment if you'd like. And if you're somehow able to figure it out between now and the end of public comment, we could still come back to you. So we have some other individuals who have been submitted to us. The next three names we have on our list are Emanuela Palmares, Elvis Novas, and Katie Curran. So we'll start with Ms. Palmares, if she's with us.
She's unable to attend today.
Okay, thank you. So Ms. Elvis Novas. Can you test your mic to make sure we can hear you?
Yes. Can you hear me?
Okay. Yes, we can. Thank you.
Right.
You can
Thank you.
proceed.
Thank you. Good afternoon, Commissioner Gifford and the staff of the Office of Health Strategy. My name is Elvis Novas. I've been a resident of Danbury, Connecticut for almost 20 years. I'm here to speak in support of the proposed affiliation of Nuvance Health and Northwell. I am representing the Dominican Community Center, a nonprofit organization that provides hopes for our community through programs and services. Some of these falls within the Nuvance Health Community Service area, like the ones provided through the Global Health Academy. I support this affiliation application because I believe this is a great partnership of two organizations with a common vision to deliver high-quality care and involvement in the communities. Nuvance has a long history of working closely with its community, so this is a great opportunity for Nuvance and for Connecticut to increase local programs and services and preserve access to essential care. As a community advocate, I'm inspired by Northwell's commitment to community and the many initiatives they have underway. Addressing disparity and promoting health equity will build on Nuvance's demonstrated track record for doing so. As a community organization concerned with the education of young people in our community, we have been able to partner and work with the Nuvance Global Health Academy, forming a community-led leadership academy designed with the goal of fostering incoming high school students into the leaders of tomorrow. Through a captivating 4 weeks, 2 days a week, lecture and shadowing experience, participants are educated on topics such as leadership, finance, health and wellness, and civic engagement. Through this experience, participants learn applicable skills and create community projects and eventually enrich themselves and their communities. Finally, I urge OHS to approve this affiliation. Thank you for your time and consideration.
Thank you, Mr. Novas. Next on the list is Katie Curran. Is Katie Curran with us?
Yes, I'm here.
Okay.
Can you hear me?
Yes, we can.
Okay, great. Good afternoon, everyone, Commissioner Gifford and OHS staff. My name is Katie Curran. I am a Connecticut resident and the president and CEO of Connecticut Institute for Communities, which is based in Danbury. I'm here in strong support of the planned affiliation between Nuvance and Northwell Health. Connecticut Institute for Communities, known as CIVIC for short, serves nearly 16,000 individuals through our federally qualified health center, Civic Health, and through our early learning and affordable housing programs and services. Our service area encompasses Western Connecticut, particularly the greater Danbury and Norwalk regions. In Norwalk, Civic runs the Head Start and Early Head Start program. These communities also fall within the Nuvance service area. An overwhelming majority of the patients, individuals, and families that we work with are living in poverty or are only slightly above it. I support this application because the sustainability of high quality, affordable healthcare is essential to our patients and our clients. Throughout the 14 years that Civic Health has been open as an FQHC, Nuvance has been our most significant and greatest community partner. Nuvance was instrumental in the start of Civic Health as the first Danbury-based FQHC, and we have a shared focus of providing care for the underserved and in training residents. Nuvance's charity care policy aligns with FQHC requirements, which allows Civic to refer those in need of certain hospital-based services to Nuvance and ensure that our patients who meet certain income qualifications receive discounted or no-cost care. Civic Health is also a teaching health center, and our Civic residents in internal medicine and psychiatry have benefited from extensive inpatient training at Nuvance hospitals. In addition, Nuvance has been a partner with Civic and the United Way of Western and Coastal Connecticut in creating the first ever food pharmacy in Greater Danbury, which benefits Civic's patients experiencing food insecurity and certain health conditions. Put simply, Civic and Nuvance are closely aligned in a shared mission to ensure that all patients, regardless of income or insurance status, receive high quality and innovative wraparound services. We are also closely aligned in our work to train a new generation of physicians who we hope to retain in our community. And Northwell is committed to the same mission of improving the health of the communities in which they serve and educating current and future generations of healthcare professionals. Northwell's planned investment in our hospitals and our communities is welcome and one that we believe will be beneficial to our collective sustainability. We look forward to Northwell's investment in enhanced care and service offerings and innovation, and we believe Northwell's presence will help attract and retain workforce in this region. I encourage OHS to approve this application, and I thank you for your time today.
Thank you, Ms. Curran. The next three individuals that we have on the list are Isabel Almeida, Marjorie Feldberg, and then Thomas Horkin. And I apologize if I have said any of these names incorrectly. So Ms. Almeida, are you with us?
Good afternoon, Commissioner Gifford and OHS staff. My name is Isabel Almeida, and I am a Danbury native and the president and CEO of United Way of Coastal and Western Connecticut, serving 27 towns across Fairfield and Southern Litchfield counties, including Greater Norwalk, Greater Danbury, and Greater New Milford, all within Nuvance Health Service area. I'm here today to share my support for the proposed strategic affiliation between Nuvance Health and Northwell, and to urge you to approve this important application. This affiliation represents a great partnership of two organizations with a common vision to deliver high-quality care in their communities. Nuvance Health has a long history of working closely with our community and of providing compassionate health care regardless of a person's ability to pay. Their dedication to community aligns with United Way's commitment to supporting the needs of households living at or below the ALICE threshold, which represents a very basic cost of living budget. ALICE, which stands for Asset Limited, Income Constrained, Employed, represents the nearly 40% of Connecticut's population who struggle to make ends meet. Partnerships like the one we have with Nuvance are critically important. I believe Northwell Health is equally committed to community and that their planned investments in our hospitals and the communities that they serve will be tremendously beneficial to ALICE households and to our region as a whole. At United Way, we are particularly proud of our most recent partnership with Nuvance and Connecticut Institute for Communities, as Katie just highlighted herself, in launching the Food Pharmacy of Greater Danbury, the first of its kind food as medicine initiative in the city of Danbury. In its first year, we are already seeing measurable positive results on the health outcomes of patients enrolled in this program who experience food insecurity and chronic illness. This is just one example of the power of partnerships between nonprofits and health systems. I believe that an affiliation with Northwell will build on Nuvance's demonstrated track record of community health, addressing disparities, and promoting health equity, and will enhance these and other local programs and services, bringing greater benefit to members of our community. I hope you will approve this important application, and thank you very much for your time.
Thank you, Ms. Almeida. My understanding is that Mr. Dubin is calling in, so he may be available. We're going to try him once more.
Great. Can you guys hear me?
Yes, we can. Third time's a charm.
Wonderful. Thank you. I hope that my comments are worth all this effort. I appreciate that. Thank you, Commissioner Gifford and the OHS staff. I'm Tom Dubin. I've lived in Wilton in Fairfield County for 25 years, and I'm the past chair of the Norwalk Hospital Board, and I'm currently a member of the Nuvance Board. I've spent time learning about Northwell, its strategies and its leadership, and I fully support this proposed affiliation. One of the most gratifying things about being on the board of Norwalk Hospital and now Nuvance has been the time I've spent on their quality committees. I see the expertise and daily diligence of our professionals who ensure the highest possible quality for our patients, and I know that they're succeeding remarkably well. Multiple third-party accolades confirm those successes. I'm impressed by Northwell's similar quality focus, and I'm very enthusiastic about combining our efforts. Northwell has established an in-house university to train staff at all levels, and they currently sponsor the 4th largest academic program in the US. I'm particularly proud of Nuvance's commitment to operating community hospitals. Our doors are open to all. We treat individual patients locally to the extent possible, and we identify and respond to community healthcare needs. Of course, we were leaders in addressing COVID. Northwell similarly invests in a community hospital model. They will maintain essential services at a local level, and they will accelerate Norwalk Hospital's ambitious strategic plan to update and expand its facilities. Further, Northwell is committed to maintaining local hospital boards to advocate for our Connecticut communities. And Northwell commits to ensuring that they commit to ensuring that local philanthropy remains local. Nuvance will be stronger when partnered with Northwell. Northwell is growth-oriented and consumer-focused. They're deeply experienced in serving all patients and are currently the 2nd largest Medicaid provider in New York State. They're also the 2nd largest mental health provider in New York State. Importantly, they recognize that healthcare is a continuum as they continue to build out ambulatory and other ancillary facilities and the expertise that will serve Connecticut well. I urge you to support this application. The combination will strengthen Nuvance's Connecticut hospitals and will allow us to provide Connecticut families with greater access to superb healthcare. Thanks very much.
Thank you, Mr. Dubin. Next on the list is Marjorie Feldberg, and then again, we have Thomas Horkin after her. And then we have an additional 1, 2, 3, 4, 5, 6, 7 people who have signed up. So starting first with Ms. Feldberg.
Hello there. I need to reverse my camera, but I'm about to become your favorite speaker for the brevity of my remarks. I'm on here as a mistake because I think the moderator did not know. I'm Dr. Jeremy Levin's wife, and I think the moderator did not know whether
Ms. Feldberg, before you
or Dr. Levin's was to be the speaker. So I am in support of this affiliation, but I have nothing additive to offer to the many other compelling remarks that the many speakers have made. So thank you.
Thank you, Ms. Feldberg. Mr. Horkin.
Good afternoon. Can you hear me?
Yes.
Good afternoon. My name is Thomas Horkin. I'm a member of Nuvance Health. I'm a licensed paramedic, and I currently work as an emergency medical services supervisor for the Danbury Hospital, as well as the emergency medical services coordinator for Sharon Hospital. Excuse me. I've been with Nuvance Health since 2015, and throughout my time here, I've had the privilege of growing both professionally and personally, and I'm here today in support of the proposed affiliation between Nuvance Health and Northwell, and to just talk about a few main points. My first one being support during the COVID-19 pandemic. Nuvance Health has been a cornerstone of support for our communities, particularly during the COVID pandemic. I was able to witness this firsthand while working on the front lines at the height of the crisis as a paramedic first responder. I saw the fear and anxiety that gripped our communities, yet Nuvance Health stood by us, providing crucial resources like PPE, additional staffing, and the support needed to keep our hospitals running and caring for patients that needed it. The partnership with Northwell will help ensure that we continue to have the resources and support necessary to face certain future challenges. Northwell's commitment to community health, addressing health disparities, and promoting health equity is an ideal fit with Nuvance Health's longstanding track record. The collaboration will enhance the work that we've already been doing to improve care and outcomes in our community, and I believe that it will drive meaningful improvements in the health of all of the populations that we serve. With that in mind, Nuvance Health hospitals, like Sharon Hospital, are vital pillars in their communities. In very rural areas like Sharon and much of the Northwest corner, many of the EMS providers or the pre-hospital providers there are volunteers. The hospital serves as a lifeline for residents. I see this symbiotic relationship every day. Our community depends on Sharon Hospital for quality care, especially in an area where hospitals are few and far between. With the support of Northwell, I'm confident this partnership will only strengthen the ties between our hospitals and the communities that we serve. As someone who's grown up in this community, worked alongside incredible colleagues, and achieved milestones that I never thought possible, I can personally attest to the opportunities that Nuvance Health provides, not only to staff, but to the patients and communities that we serve. This organization has supported my growth, and I know that with Northwell's support, we will continue to improve the care we provide and the experience of our patients and staff alike. In conclusion, I urge you to approve the proposed affiliation between Nuvance Health and Northwell. This partnership will ensure that our hospitals continue to thrive, our communities receive the care that they need, and that we build the strong foundation that Nuvance Health has established over the years. Thank you for your time and consideration.
Thank you, Mr. Horkin. The next three individuals are Amy Lorena, Yemi Matos, and Lauren Enriquez. So starting first with Ms. Lorena.
Hi, everyone. Cross-check that you can hear me.
We can hear you.
Okay, great. So thank you so much, Commissioner Gifford and the OHS team. My name is Amy Lorena, and I am the Director of Quality at Sharon Hospital. I am wholeheartedly in support of the affiliation of Nuvance Health and of Northwell. I believe this is a great partnership of two organizations with a common vision to deliver high-quality care in their communities. So I've been an employee in one of Nuvance hospitals for over 30 years. I've been at the bedside as a nurse. I've been a risk manager for some of our hospitals, and I'm now in quality. During my time here, I've seen Nuvance be here for our communities and for our state. And Northwell, I've done lots of research on Northwell as well in anticipation for this affiliation. And I can see their strong commitment to their communities with an emphasis on quality, safety, patient satisfaction, and equity as well. During this time, I did have the opportunity to meet with some of the senior leaders of Northwell during the affiliation meetings. I saw firsthand just how committed the team was. You know, in life, we certainly get unexpected events, right? Generator failures, floods, terrible storms. These are some of the things that keep me up at night. When I met with the Northwell team, their approach was like a SWAT team, you know, come in, very, very involved with teamwork and just getting the work done. I also saw firsthand their commitment to education. I saw lots of investment in research from the Northwell team, a great sim lab. So the emphasis on teaching, I believe that this affiliation will help with our medical professionals and students in Connecticut. I've highlighted just a few reasons why I support this affiliation, but there are many more. I believe together we will be better, and I would recommend that the state approve this application. Thank you very much for your time.
Thank you, Ms. Lorena. Next is Yemi Matos.
Hi, can you guys hear me?
Yes.
Good afternoon. My name is Jamie Matos. I am the Director for Environmental Services, Laundry, and Transport Services at Danbury Hospital and New Milford Hospital. I have been employed with this organization for 18 years, and my family and I also reside within the community we serve. Thank you for the opportunity to testify, for letting me testify today. I'm very happy to support the proposed affiliation of Nuvance Health with Northwell. This application is for a strategic affiliation between Nuvance Health and Northwell that will ensure continued access to high-quality healthcare services. It presents the opportunity for a great partnership of two organizations with a common vision for providing patient care in our communities. COVID-19 was a very difficult time for us. Nuvance Health was there for the state and its community during COVID-19, and it has been for many years. We need to make sure that it is there for us in the future. This partnership with Northwell will help us do that. Northwell's commitment to community health, addressing disparities, and promoting health equity will also build on Nuvance's demonstrated track record for doing the same. Together, Nuvance and Northwell will also be able to deliver great care across Western Connecticut. I would highly recommend the state approve this application. Thank you.
Thank you, Ms. Matos. And next is Lauren Enriquez.
Good afternoon. Can everybody hear me?
Yes.
All right. Thank you for allowing me the opportunity to speak today. My name is Lauren Henriquez, and I am the neuroscience coordinator for Danbury and New Milford hospitals. I started with the organization as a new graduate registered nurse on the step-down unit at Norwalk Hospital back in 2013, moved to the emergency department, and after an investment in continuing nursing education, I was able to complete my graduate education at Fairfield University free of charge and have been in my current role for the past 6 years. I am in support of the proposed affiliation of Nuvance Health and Northwell. Northwell's commitment to community health, addressing disparities, and promoting health equity will build on Nuvance's demonstrated track record for doing so. As part of my role, I provide community education on recognizing stroke signs and symptoms and knowing when to call 911, and have no doubt the Northwell affiliation will support my outreach programs. This application for a strategic affiliation between Nuvance and Northwell will ensure continued access to high-quality healthcare services in our communities. We have expanded the level of stroke services available to patients in our service area, and this partnership will continue to support our growth. My extended family and I live in the Danbury Hospital community, and I am confident this partnership will enhance access for our families. Continued access to high-quality care is even more important as I prepare to deliver my first child at Danbury Hospital in the next few weeks. I thank you for your time and hope you will approve this important application. Thank you.
Thank you, and good luck with the remainder of your pregnancy. The next three individuals we have are Stacy Pete, Nick Moore, Kathy Metz, and then I'll say the fourth, Tracy Marina. So we'll start with Stacy Pete.
Hi, good afternoon. Can everyone hear me?
Yes.
Yes. Hi, my name is Stacy Pete. I'm the Director of Community Engagement at Norwalk Hospital, part of Nuvance Health. And I'm here to speak in support of the affiliation between Northwell and Nuvance. I've worked in the community health department for the past 10 years over at Norwalk Hospital. I can see the many benefits that the merger will have for me as an employee, but most importantly, I care very deeply about the Norwalk community, and I can see the benefits of having Northwell as a partner. I know that Nuvance has been a vital partner in our community. I want to see our community programs continue to grow and thrive, and I'm confident under Northwell that they will do so. I'm impressed by Northwell's commitment to the communities that they serve, particularly around mental health, which, as you know, is definitely an underserved population. I am someone who works very closely with a lot of the community providers in the Norwalk area, including the police department, probation, local homeless shelters, housing providers, mental health providers, and substance providers. I've had the honor of working on starting 2 clinical teams within Norwalk Hospital that follow some of our most vulnerable patients, those with substance use, mental health use, often homeless. And I am confident that we can continue to build on that work, as we all know how important it is to improve our health outcomes for some of our most vulnerable. So I am very excited to think about the possibilities for us to grow and expand under Northwell. So I urge you to please consider to approve this application.
Thank you, Ms. Pete.
Thank you.
Nick Moore.
Can you hear me?
We can hear you, but we can't
Hello,
see
can you hear me?
Yes, just give us one moment to. Okay. Yes,
Okay.
you can proceed.
Yes, so this is Nick Moore calling in. Thank you, Commissioner Gifford and Hearing Officer Chuka. Thank you in the Office of Health Strategy for granting Save Sharon Hospital limited intervenor status so that our local heroes, Dr. Howard Mortman and Dr. David Kurish, could provide their inside perspective gained over decades serving our community. I live in Sharon, Connecticut, and I'm on the board of Save Sharon Hospital. I had the pleasure of meeting with Mark Salazzo and Kevin Biner from Northwell Health in Sharon in September. I was impressed and gratified that they took time to have a dialogue with community members before this public hearing. I wish to express my support for the affiliation between Northwell Health and Nuvance Health, provided that you kindly incorporate into the agreed settlement the promises Northwell Health made to Save Sharon Hospital in the letter dated October 22, 2024. My wish, if this affiliation goes forward, is that community interaction will be regular and in person. I listened to the questions and answers about the new affiliation and board structures, and I'm wondering if there will be term limits and a transparent nominating process for board members, at least for the individual hospital advisory boards. In closing, I've been impressed again today, listening to the testimony of the CEO of Northwell, Michael Dowling, and Chief Operating Officer Mark Salazzo, especially their aversion to a hub and spoke model. My fervent hope is that the cultural and financial resources of Northwell Health will be transformative for Nuvance Health and Sharon Hospital. Thank you very much.
Thank you, Mr. Moore, excuse me. Next on the list is Kathy Metz. Is Kathy Metz with us? Okay. We're going to move on to the last person, Tracy Marina. And she also apparently is not available. So with that, that concludes oh. Okay. I apologize. I didn't realize that. All right, so we have 2 more individuals. We have Lydia Moore and Victor Jermack. So Ms. Moore, you can proceed whenever you're ready.
Thank you. Thank you, Commissioner Gifford and attorneys Chuka and Jackson for granting us this time to speak with you today. My name is Lydia Moore. I'm a resident of Sharon, Connecticut, and the president of Save Sharon Hospital, Inc., a 501c3 nonprofit dedicated to preserving high-quality healthcare locally. I'm also a mother of 3 born at Sharon Hospital, ages 1 to 7. And this is the fourth time I have provided public comment before OHS at a hearing regarding Sharon Hospital. But this is the first time that I'm cautiously optimistic and, dare I say, hopeful about the future of healthcare in my community, especially that Sharon Hospital will remain a full-service hospital indefinitely. Northwell executives drove several hours to meet with my organization in the northwest corner of Connecticut regarding what will become one of their smallest hospitals if this affiliation moves forward. This was a more than welcome change in approach to engaging with the community, and I couldn't be more grateful for their time. Northwell executives seem to truly want to help the people in the communities they serve. I am still shocked that after we gave them our list of requests for Sharon Hospital, that they addressed every concern and incorporated most of them and more into their final list of pledges to our community in the letter they wrote to Save Sharon Hospital dated October 22nd, 2024. This letter includes not only their promises to keep all services open at Sharon Hospital, including maternity and the ER, but making sure that we return to truly having critical care services through the progressive care unit, and that we will once again have 24/7 general surgery coverage. In addition, they have pledged to expand primary care and subspecialties, and they actually seem eager to work with our community. I will admit to some wariness on my part that these promises seem almost too good to be true, given my prior experiences. But when I think back to the in-person meetings that I had with Mr. Salazzo and Mr. Biner from Northwell, when I read the pre-filed testimonies of Mr. Dolling, Mr. Salazzo, and Dr. Silver, and then when I heard them all testify today, I have to admit that I believe them. I believe they will do the right thing for healthcare in the northwest corner of Connecticut, as they are doing for our neighbors in New York. Dr. Gifford, I respectfully ask you to please grant the affiliation between Northwell and Nuvance while incorporating the list of promises that Northwell gave to my organization in the final. There we go, in the final agreed settlement. I'm truly optimistic that this letter will serve as a guide for reinvigorating Sharon Hospital, which is a pillar of our community. Thank you to Northwell for finally giving me hope for the future of healthcare in my rural community. And thank you to OHS for holding this important hearing.
Thank you, Ms. Moore. And last but not least, Mr. Jermack. And Mr. Jermack, before you begin, just a reminder to speak into the mic. It seems like you're sitting a little far away from it.
We'll try that. Good afternoon. Good afternoon, Hearing Officer Gifford and the OAS staff. My name is Victor Jermack. I have lived in the Salisbury-Sharon area for the past 40 years, and I have a professional financial and managerial background. I have previously testified before OHS on behalf of Save Sharon Hospital, supporting labor and delivery and other essential services. I first got involved in trying to preserve Sharon Hospital services as part of a nonprofit community group, the Community Association to Save Sharon Hospital, which was the predecessor group to Save Sharon Hospital. In 2001, when we first testified for Sharon Hospital, in the first of its 4 sales to other acquisition groups and hospitals. This is the 4th. I won't go into all the service reductions and staff cuts in the intervening many years at Sharon Hospital, as these have been amply documented in our current and prior filings and statements to OHS and supported by your records. Presently, I'm a vice president of Save Sharon Hospital, and I personally provisionally support Northwell's affiliation with Sharon Hospital, provided that they fully support and implement their promises and written commitments to Save Sharon Hospital to fully support labor and delivery, progressive care, staffing, and other issues, which they have made to us. I have met with the two senior Northwell executives overseeing this affiliation, and I was impressed with their dedication and vision for Sharon Hospital and their intention to improve the existing conditions in labor and delivery, progressive care, and other areas at Sharon Hospital. I strongly urge OHS to include their commitments in your final order, independently monitor their level of compliance with their commitments for the next 5 years, and take all necessary corrective steps to ensure their compliance. In retrospect, the CT Health Quest merger conditions were not abided by Nuvance, and the independent monitor process at the time did not afford practical oversight. Let me suggest the following compliance procedure to ensure that Northwell followed through on its commitment to save Sharon Hospital. First, that OHS select and utilize a compliance auditing team consisting of 1, a qualified outside unaffiliated professional group with specific monitoring expertise in this area. The independent monitor parenthetically should be paid by OHS directly, and in turn, OHS should be reimbursed by Northwell. 2, Save Sharon Hospital should also be part of this independent group representing our community. In effect, 2 monitors. Furthermore, Save Sharon Hospital should be involved in the selection of the outside independent monitor. I would recommend that the monitors jointly develop objective, specific, quantitative standards to measure the compliance with Northwell's written commitments and promises to Save Sharon Hospital. Secondly, that Northwell should publish semi-annually the results of its specific compliance to its commitments. Thirdly, that the monitors should meet publicly and in person with Northwell and the Sharon community every 6 months to discuss these results with the Northwell Hospital management. If there are shortfalls in the performance between Northwell's stated commitments and standards, then a correction plan and timetable should be established by Northwell within 30 days for OHS's consideration and approval. Lastly, there should be periodic follow-up by the monitors and OHS to ensure compliance with its commitments. Thank you very much for your consideration. I do appreciate it, and we appreciate it.
Thank you, Mr. Jermack. Attorneys Volpe and Jensen, do you or your clients wish to respond to any of the public comment that came in today?
No, we do not.
Okay.
Thank you.
Attorney Jensen?
No, we do not. Thank you.
Thank you. So OHS will confer with one another and determine whether we have any additional questions for the applicants based on the public comment. For right now, this concludes the public comment portion of today's hearing. We're going to take, what, 10 minutes? No? We're going to take 5 minutes. Then we will come back on the record. So let's say 2:20. And I will see you all again in 5 minutes. Welcome back. For those just joining us, this is a hearing regarding Northwell Health and Nuvance Health's planned affiliation. It's CON application docketed as 24-32717-CON. The applicants again are seeking transfer of ownership of a healthcare facility as well as transfer of group practice. We just wrapped up the public comment portion. We're going to go back to the technical portion and complete that hopefully this afternoon. So I'm actually going to turn over some of the questioning to Attorney Jackson over to my right. And Mr. Jackson, you can proceed whenever you're ready.
Thank you. Before we start back where we left off, I wanted to follow up on a couple of points that were raised in the public comments. We heard a lot about the engagement that Northwell has undertaken with the Sharon community and Save Sharon Hospital. Has Northwell worked with the communities around Norwalk and Danbury hospitals as well?
Not to this point, sir.
We also heard a question about board nominations and appointments. So could you speak a little bit about first the joint board members between Nuvance and Northwell in the first 5 years, how those will be appointed and who has the appointment authority there?
Okay, thank you. I'm actually going right to the affiliation agreement to answer these questions. And what will happen is well, let me start with the advisory boards. So the existing boards of those hospitals will be reconstituted as the advisory boards. So those existing boards become the advisory boards. I'm sorry. So that's the way that works. For new nominations to the Northwell board, the Nuvance existing board will nominate their members. They will go to the Northwell Nominating and Governance Committee and then to its board for approval. If the Nominating Governance Committee or board doesn't appoint any of those members or doesn't appoint one of them, the Nuvance board will appoint other members until they get the requisite number of members on the Northwell board. Similarly, the Nuvance will appoint of the 25-member Nuvance board. The Nuvance board, 18 of them will come from the Nuvance board. North will appoint its 6 members plus the CEO for approval by the Nuvance board, and then they would be added to that Nuvance board.
So after the initial 5-year period, does Nuvance still propose designated board seats to the Northwell board?
No, after the initial 5-year period, what we traditionally do is the nominating and governance committee for Northwell makes all of the appointments, and then they are approved by the Northwell board. And that applies not only for the fiduciary boards, the actual hospital boards, but for the community advisory boards as well.
Thank you. So we'll pick back up with where we left off discussing improving the finances at Nuvance. The applicants have described at length the financial challenges at Nuvance. However, the applicants say that they will not undertake some of the typical efforts or tactics to improve the financial conditions. So in the application and today, we've heard Northwell will not terminate or reduce services. Northwell will not seek to increase prices. Northwell intends to keep the executive leadership and management of Nuvance, and Northwell intends to keep the Nuvance board at least partially in control of Nuvance, at least for the first 5 years. Is it correct that none of those standard methods that we typically see for improving finances will be employed here?
That is correct. That is correct.
And has Northwell employed that list of standard methods in the prior affiliations?
All of them.
So what makes this affiliation different to Northwell that those standard sets of tactics would not be employed here?
I'm sorry, I think you misinterpreted my response. We're consistent in that approach.
Oh, consistent that you do not employ
That's
those
correct.
approaches. So a couple of the approaches that we have heard about today, cost reductions from group purchasing, revenue cycle improvements. I think we heard from Nuvance that some efforts have already been undertaken in those realms and have seen improvements of $76 million roughly in the last year. Do you believe that those kinds of improvements alone are enough to erase the remainder of the $99 million deficit?
I think our Nuvance partners have done an excellent job of trying to address some of those concerns, and many of the tactics are similar, as you noted. Where the advantage that Northwell, I think, brings is once again the scale of what we've done with regard to our shared services, which is even more expansive than what Nuvance currently has. And so the ability to reduce facility maintenance costs, the ability to insource things with expertise across the network reduces overall cost. And so we will continue to enhance what Nuvance is doing and look for other opportunities as well.
And on the topic of revenue cycle management improvements, will that affect how ECAs, stands for Extraordinary Collective Actions, are handled at the hospitals?
Is that part of our financial assistance policy? Okay. Yes, in fact, it would be more positive because since the filing of the CON, our financial assistance policy for patients has actually improved and has been set forth as a model with our Attorney General. And so now it's more rich than the current Nuvance policy, and Nuvance will be adopting our new policy.
All right. I believe we have that in the record. The policy.
Yeah. Yes. It's in there.
One of these. Thank you. With the same executive leadership, management, and board at Nuvance, with the addition of the 6 members, but first question, will the voting on the Nuvance board be 1 member, 1 vote, so that the 6 Northwell members do not control the board?
Yeah, that's correct. Yeah. But no, we're putting 7 members on the board, so it will be 28%. So to get to 75% for a key vote, you'll need to get 1 Northwell board member to align with the Nuvance board members.
Thank you for that clarification. So with the same executive leadership and management, the board, as we just discussed, how will Northwell ensure that all of the Northwell programs and initiatives are implemented in the way that Northwell would want at Nuvance?
Wish we had more mics. So as part of the affiliation, that's great. Thank you. So as part of the affiliation, Nuvance and Northwell agreed that the management teams at the executive level, the executives of the various services at Nuvance will report into the Nuvance CEO, but also to their counterpart at Northwell. So that will help ensure the integrity of the programs that we put across the systems.
Thank you. So continuing on the thread of where the improvements are coming from, the estimates, the projections for volumes seemed to increase at about 8 to 10% over 5 years. Is that consistent with what you're projecting?
That's, I think, their projection.
Just for a point of clarification, is that the with and without the CON financials, or where is that that percentage you're referencing?
Application.
Just to help to make sure we're fully responsive.
Clarification here. Yep, I got the numbers. So they are our numbers, and they're based upon historic levels of growth. Inpatient volume growth at a historic level of 2%, and outpatient aggregate volume growth historic levels of 8%. So they are our numbers.
And just for reference, I'm in OHS tables 7 and 8. Application NH 079 and 0. NH 0079 and NH 0080. And the application, and this is reflected in the bench memo that was sent last night as well. It says that there will be no shift in volume away from existing providers and no impact to established referral patterns. Is that correct?
That is correct.
So earlier we heard about at South Shore, you're needing to build a new tower because demand increased so much. So are you not expecting similar increases in demand for services here? And if so, where would that demand come from?
I think that right now, during our assessment period, what we'll try to do is understand where the clinical gaps currently exist. We're getting some indication from that, from talking to the providers at the various hospitals about programs that could grow that to meet some unmet need. And so we will focus on that planning process first to understand where the growth will come from.
But so your expectation is you'll be providing care that is currently not met by anyone.
Our expectation is that we will be providing care that is not met by other providers at this time.
Yeah, I just want to make sure that we're clear on the concept here, because also throughout the application, you talk about bringing patients closer to home. So I'm assuming that you've done some analysis of leakage out of the primary service area, that you're losing volume to other providers, and you want to bring those back into the PSA. Am I correct then that there would be some impact to the rest of the system by repatriating, I guess if that's the right word, some of that leakage right now back into the Nuvance service area?
I stand corrected, Commissioner. You are right. For example, the Sharon community, we do know that some patients are traveling outside for those services. We'd hope to be able to reincorporate them back into that community.
And that would constitute some part of the projected volume increase. Thank you.
Yeah, you increase the possibility for local people to have more choice about where they want for care. If they want to go local, we have to give them the ability to go local to avoid them having to travel long distances and have inappropriate transportation. It would be a patient's choice. So it's all about making sure that we provide the services so that people locally can go locally. If that means that now not going somewhere else and they want to come back and go locally, I think that's an important thing and very consumer focused.
And do you have any sense, you may not, but of what part of that projected 8 to 10% growth in volume is from bringing back the patients from the primary service area as opposed to meeting unmet
Not yet,
needs?
Commissioner. We really haven't done an in-depth planning analysis at this time.
Thank you.
Are you able to do that sort of analysis prior to consummation of the transaction?
I think it's been noted in the application, there are a fair amount of restrictions based on the antitrust laws and so forth. So I think the applicants have done as much as they can in looking at certain information, data, and affiliation to inform the percentages that you have before you. But there are certain legal restrictions that impede us going any further until the affiliation's been approved and consummated.
Okay, so I'll ask Nuvance then. Have you performed that sort of analysis? Specific to going back to Dr. Gifford's question earlier about leakage, have you performed an analysis of the amount of patients that are leaving the PSA? Yes.
Yes, we know that by our major service lines where we're losing cases
either to other competitors within the state or out of state. That's standard information that I think every health system looks at.
Okay, it's just that you can't provide that to them.
Correct.
Okay.
So regarding the $1 billion investment, you provided a helpful breakdown by topic in the presentation today on slide 19, and we'll come back to that. But do you have any estimates of the split of that $1 billion across the different hospitals or even across the states of where the hospitals are in New York and Connecticut?
Not at this time. We have to do an in-depth, we started an in-depth planning assessment on the infrastructure. We note that there are a number of infrastructure needs that are beyond useful life on the Connecticut side, but we have not gone any further than that at this point in time. That would be one of our first items to address.
Does Northwell anticipate recouping the $1 billion?
Well, we're hopeful that Nuvance will be accretive to the overall. We don't look at separate. If we do our work right, then Nuvance will be accretive to all of the health system. Will be able to repurpose those dollars back into providing even better care, more technology, more modern facilities.
So what I'm trying to understand is we were talking about, as of last year, $160-ish million deficit. We're now at $100 million deficit. It's going to take 5 years to break even, and then to start accruing something back to the organization as a whole. And $1 billion has been poured in. So I'm just trying to figure out kind of when the investment breaks even in the long run.
So we don't look at it that way. We look at trying to make certain that the entities are all cash flow positive so that they're sustainable, but we don't look at this as a return on investment. It's part of our mission. If you look at some of the work that we've done in our previous affiliations, we've spent probably over $800 million at South Shore. We don't look at it and do analysis like that.
The goal is to make sure that the hospitals over time are successful quality-wise, financially, et cetera, and providing access to the community. And we've done this multiple times. And in all of those situations, there's always the question at the beginning, what exactly are you going to do? And it requires an awful lot of assessment and analysis that we yet have to do. But the goal is, as Mark said, is to make the facilities successful, be accretive to the overall organization. When that happens, then you have more money to continue to reinvest, as we have proven in many, many other places. So remember, when all of this occurs, we're all one family. So it isn't one side versus another. It means we all win together. And that's the idea of the systemness, which was mentioned at the very, very beginning. We're in together, we'll all succeed together, we make it all successful over the long haul. It takes time. There are no quick fixes here, which I think is important to understand. But as I said at the beginning in my introduction, we think long term.
So if we can turn to slide 19 from your presentation today, it's the capital commitments. Can you clarify what the commitment is? Is the commitment the total amount of $1 billion, or is it to complete this set of projects which have a low, medium, and high range provided?
It's both. It's both. The commitment is $1 billion. As I stated in my previous introductory remarks, that we have exceeded our capital commitment in every case. This is a best estimate, knowing what we know. There's a lot we don't know, and we're just finding out. And as I said, we never walk away from the hospital. This commitment could be much higher over time. Right now, this is our best estimate.
And
Just to add to that, in pretty much every previous affiliation like this, the original number that was being given, which was at the time our best estimate, in every circumstance, there was increased investment above and beyond that, because you're investing in yourself. Remember, you're investing in your own organizations over time to make them successful, and that's the same goal here. So in every one of our facilities, whatever number was upfront, the investment over time, as Mark alluded to, has actually been greater.
And while perhaps not likely, in the event that you landed in the low bucket on all of these, would Northwell be looking for additional investments to reach that $1 billion?
Absolutely, because once again, going back to Michael's Dowling's point, is that these will be our facilities. And so we want to be able to provide the best possible quality care to these communities, which requires constant investment way past the 5-year commitment.
Can you, speaking to the fact that these are best estimates, and I think throughout the application, there's a lot to, Attorney Volpe's point, talk about the limitations of collaboration between the parties. Can you speak to how the work has been done so far to come up with these numbers, and then what the integration process looks like in that planning process?
Sure. With regard to, well, some of it is our experience, some of it is discussions with Nuvance, and we came up with ranges and estimates during the negotiation phase with Nuvance to sort of put these things in buckets. I'm sorry, the second part of your question?
What the integration planning phase looks like and how that works.
Sure. Give me one moment. You have that page?
It is in our, it is in the docket. There's an integration planning committee, and there's various iterations of that. We can try to identify it.
I have it.
You have it?
Yeah. So we established early on an integration planning committee, which is overseen by Dr. Murphy and myself and several key executives of both institutions. As I said earlier, it started to focus on first what could be the pre-activities that we can engage in prior to the affiliation being signed off on. We've first started with regard to cultural activities, which Michael can get into, but we rounded around at each hospital. We did town halls at each hospital. We think that's really important based upon our previous affiliations. We see that as a gating step to make certain that the team members understand who we are, what we're trying to accomplish, get their buy-in, really getting them to help achieve the objectives that we want. Every employee, every provider, and we're continuing to do that. So that is one activity that is nonstop and continues today. We also organized work streams, different work streams. We actually have 48 distinct integration work streams across operational and functional areas. I won't go into all 48, but they're in 4 buckets. 1, clinical. I'll highlight just a couple: community and pop health, patient experience, quality, nursing. Non-clinical, IT, facilities and infrastructure, HR, organizational resiliency and business continuity. Finance, accounting, analytics and reporting, supply chain, risk management, legal affairs and compliance. That work is continuing as we go on, so that as to prepare for day 1 start. There are limitations on what we can share, on what we can do, but we're getting the teams to know each other and start identifying early priorities that we can focus on once the affiliation is complete.
So I'm going to shift to some questions about payment to the hospitals. So in the, yes.
Yeah, I have a couple follow-ups too. So.
Before we go on.
This is speaking to Boyd's questions about sort of process. You note in your application that Nuvance Health initiated a competitive bidding process to solicit buyers for real estate. That was considered, that non-hospital real estate owned by Nuvance Health affiliates was considered selling those. Is that something that Northwell has ever done when acquiring a hospital system in the past in order to raise capital?
I'm not exactly certain I understand the question, Commissioner. Are you saying that we intervened with the sale of their assets, or?
No, so in the discussion on page NH 0043 of the existing financial condition at Nuvance, discussing that one option that was considered was the sale of non-hospital real estate assets. We have some experience with such process here in other systems, and I'm wondering if that's something that Northwell Health has done in the past.
We review all of our assets and we'll review all of Nuvance's assets, those that are not core to the mission of the institution, I would say would be under consideration. However, we refrain from selling assets that are contiguous to Nuvance assets because we don't know what use they may be in the future, so we want to refrain from that. And so there are no plans to sell any assets at this time.
That's helpful.
I think I know the answer to this, but I'm going to ask it anyway. Are there?
Hopefully I do.
Well, if anybody does, I think you might be the one. Are there geographic limitations on the allocations of the 1 billion? So like, are you approaching it as like 750 will go to New York and, okay.
No, with the exception of a couple of projects that Nuvance identified for us in the facilities improvement phase, such as the Norwalk Tower, and there was a couple of other things. There is no specific allocations back and forth.
Okay.
All right, now we'll go to a couple of questions on payments. In the completeness letter response, the applicant said, Nuvance will retain the responsibility for negotiating commercial payer contracts for the Connecticut hospitals, but Northwell Health's coordination and oversight of this function will occur as the applicants coalesce into a single highly integrated health system. Could you explain what that means regarding negotiating payer contracts?
Yes, so back to my other response with regarding to the executives at Nuvance and Northwell working together. The executives at Nuvance who would oversee this would also have a reporting line into the executives at Northwell for that function, as well as up to the Nuvance CEO for every single service.
And so with dual reporting, who has ultimate authority to approve the payment and reimbursement rates?
I guess we can also.
Can you repeat that question for us?
Sure.
Yeah.
So with split reporting to the Nuvance CEO and their counterpart at Northwell, who has the ultimate responsibility for approving commercial payer contracts and reimbursement rates?
We just want to note for the record, I'm not testifying, but it's in the application that the existing payer contracts are going to be retained. So
Sure.
Certainly as it relates to existing contracts, you're talking about in the future?
Yes, so this said, the response to the completeness letter says Nuvance retains responsibility to negotiate commercial payer contracts. Northwell Health's coordination and oversight of this function will occur as they coalesce into an integrated system. And we just heard testimony that Nuvance's negotiation team will simultaneously report to the Nuvance CEO and the Northwell commercial payer contract folks. So I'm asking, who has the ultimate authority to approve or deny these payer contracts that will be negotiated when the current ones lapse?
Yeah, I mean, the affiliation agreement provides that the Nuvance executive team has a dual report. They report to the Nuvance board, to the Nuvance president, CEO, and to their functional equivalent at Northwell. So it's a little bit of a group.
So
group effort
does
during
each
the
have
transition period.
simultaneous veto authority over? I'm trying to just understand who's ultimately responsible for deciding whether the commercial payer contract.
Let
is
me answer
accepted.
this question. This is a combination and we work together in a collaborative partnership. The ultimate responsibility of going forward, since Northwell is the ultimate owner of Nuvance, will be Northwell. But it is done in a partnership between Northwell and Nuvance. Nuvance has a team working with the CEO there. We have a team working that does all the contracts at the Northwell side. There is a reporting into Northwell. It's a partnership. The ultimate responsibility, though, at the end of the day, assuming this is all approved, is Northwell.
And will the responsibility of Nuvance retaining will the fact that Nuvance retains the responsibility for negotiating commercial for negotiating the commercial payer contracts, does that change after the 5-year transition period, or is that ongoing?
Ultimately, after the 5-year period, our chief of managed care would be the one who would have the ultimate role there.
We have a chief of managed care contracting. At the end of the day, that is the person who will have the ultimate responsibility. But understand again that all of these things are done in partnership with the local entities. So make sure that everybody sees this. The ultimate result is as a win. So it's not like you sit in a room by yourself and you just make those decisions. That's not how we work. It's a very collaborative process. But you're correct. The ultimate responsibility at the end of the day is not.
It is 2 markets though, and it is 2 different payers. So there is no market overlap with regard to the payers in Connecticut and the payers in New York. And we've made assurances that we will continue to negotiate those payer contracts separately.
So I'd like to discuss, we took administrative notice at the beginning of the hearing of the RAND 2020-2022 study and the reporting that they do through SAGE Transparency 2.0 data. The Connecticut state average reimbursement as a percentage of Medicare is 270%. The Nuvance hospitals come in a little lower than that. Danbury Hospital is consistent with the median at 270%. Norwalk Hospital is 273%, and Sharon Hospital is 213%. Looking at,
and I'm sorry to interrupt you, but some of this does go to executive session and materials that were submitted.
So I downloaded this last night from RAND.
Okay, but the numbers that you're providing for Nuvance itself?
I pulled from RAND last
not from
night.
anything that's been, okay.
Correct. Last night, as I have waited watching the news, I pulled these numbers.
Understood.
The hospital system total price for Northwell, the hospital system total price, which combines inpatient and outpatient, was 343% of Medicare reimbursement rate. So do you anticipate there being a shift for the Nuvance hospitals that would be more in line with the rest of the Northwell system reimbursement rate?
So once again, 2 different markets, different payers, different providers. It's idiosyncratic to the market, the rates that you are able to negotiate with the payers. We will make good faith effort to negotiate fair rates with the payers to support Nuvance. But do I anticipate equalizing? No.
Just to follow up, going back to the Connecticut and New York markets, currently you don't own any hospitals outside of New York,
That's
I'm
correct.
Okay. So with respect to the charitable assets of Nuvance for Connecticut, so philanthropic dollars that have been raised to support Nuvance charitable causes. And I think, Dr. Murphy, you might have mentioned the tower at Norwalk Hospital, that there's some designated funds there.
Mhm.
Is it in the affiliation agreement, or can you point us to where and share with the community specifically the treatment of those assets and assurances that they will remain in Connecticut for the purposes for which they were raised?
Of course.
Yeah, it's actually in the affiliation agreement at 6.12.1, we say philanthropic funds raised and grants received by Nuvance, whether restricted or unrestricted, will continue to be deployed in a manner consistent with the direction of the respective donors and guidelines. So in support of the Nuvance mission and its service area, will remain subject to the oversight of Nuvance. So we go on to say, for the avoidance of doubt, any and all charitable donations received by Nuvance prior to or following the effective date shall be used in a manner consistent with the applicable law, and contractual obligations shall be separate and apart from the capital commitment.
Thank you.
That's 6.12 of the affiliation agreement.
On page NH0031, there's a description of the process that Nuvance went through in soliciting potential partners. And I just wanted to clarify one thing, because as I mentioned at the outset in my remarks, one of the criteria that we are asked or directed to evaluate for hospital transfers of ownership is whether other offers were fairly considered. It wasn't clear to me in reading this and other parts of the application whether or not other offers were received, and we're not asking for the details of whether or not there were any other offers, but it states that you solicited bids and then provided potential strategic partners with bid term sheets, and then interviewed Northwell and engaged in a robust question and answer session. But there's a tiny bit of a gap there in whether or not other bids were received. So we just wanted to clarify that for the record.
And Commissioner Gifford, I believe that specific issue was addressed on a confidential basis in the party protected material that we could definitely address during executive session.
Okay.
Thank you.
Thank you.
Okay, so that is it for general questions, I think. We do have, I guess, a few questions for executive session though. And there is, sorry, I misspoke. There's one general open session question that we're going to ask after executive session. But in terms of executive session, we're going to turn our attention to that now. Executive session has a different procedure that is involved in order to ensure the confidentiality of all the information that will be disclosed. So the following procedure will be utilized for any occasion in which we need to go into executive session. I will announce who from OHS will be attending the executive session and ask that the appropriate attorney or attorneys from the applicants identify who they will need to have attending the executive session. I will advise the court reporter that the transcript for this executive session should be designated confidential and not subject to disclosure. And once completed, should only be provided to the email address, which is ohs.confidential@ct.gov. And then we will then share that with Northwell's or Nuvance's attorney once it is received. We will then take a short break. During the break, all individuals other than those that the attorneys identified, OHS and the court reporter will be excused from the room. In addition, OHS will exit one Zoom meeting and enter into the other meeting via the appropriate link that OHS supplied to council. The open session will remain on, but there will be a new slide posted that indicates the parties are in executive sessions. Once the executive session is completed, we will take another break. During the break, OHS will allow all those excused to come back into the room. OHS will also exit the executive session Zoom meeting and we'll all come back into the open session, utilizing the link for the open session. Council, do you have any questions about what I just described?
Only that the majority of the submissions are confidential to the public, but not necessarily to each party. And when we do move to executive session, presumably you've identified which are party-specific confidential questions you want to proceed with. If any.
The only question I'm aware of is the one that just came up.
Okay.
Okay.
Yeah, and that would be a Nuvance party protected discussion.
Correct.
Yes.
Okay. We also have Northwell party protected executive session.
Okay.
So maybe let's take a 5-minute break. Let's say 10-minute break. And we'll start with the Nuvance executive session because that's the question that just came up. So Attorney Jensen, who would you like to have present for that?
Well, while they're conferring, will we have access to that breakout room as we depart? Or are you staying here and we will leave for their party protected? Is the only reason I ask is if you have joint applicants confidential that is public protected, probably if you're ready, we can all stay in both applicants. But if you're going to start with the party protected of Nuvance, obviously, we'll go to a breakout room.
I think my concern with that room is it's pretty connected to this room. It's actually very connected to this room.
Always fine.
We could go further into the foyer.
We're going this way.
Okay, you just direct us. We can just go to the lobby. You can retrieve us.
we're going to take a 10-minute break and we will let you know who we need here. Yes, and at that point, I will sort of go through the spiel again and we will figure out who needs to remain here and who can go elsewhere. Attorney Knag has. Yes, we're okay with Dr. Kurish being excused. Thank you.
Thank you, Doctor.
It is docket number 24-32717-CON. They're seeking a certificate of need for the transfer of ownership of a healthcare facility and the transfer of a group practice. We are still in the technical portion. We had the public comment portion earlier. Before we took a break, I made reference to one open session question that we needed to ask. We are prepared to ask that question now, and it'll be directed to both of the applicants, but it's concerning Northwell's compliance with one of the questions in the application. I'm going to direct them to page number NH0102. And I will give you a moment to pull that up. And it's at the very bottom, beginning at subsection C. So the question is, well, I'll just read what it says and then I'll pose the question. It says, for each applicant and any new entity is to be created as a result of the proposal, provide the following information as it would appear prior and subsequent to approval of this proposal. A legal chart of corporate or entity structure, including all affiliates. And we note that that was provided for Nuvance. And a very small portion of Northwell. So what we would be looking for is Northwell to fully comply with that in terms of providing a full organizational chart. Okay, so that was a lot to get to a very small answer. Okay. So thank you for agreeing to that. That'll be a late file. While we're on the topic of late files, Dr. Murphy, I believe, mentioned earlier that they would be willing to provide a more complete and full table of organization that includes, among other things, the for-profit entity that Nuvance has. So we are going to be asking that that be made as a late file as well. Do you have any objection to that, Attorney Jensen?
No objection.
Okay. And We also discussed earlier the unaudited financials for Nuvance. And I think that was resolved.
One clarification on that, if I could.
Sure.
I believe that the unaudited financials would need to be submitted confidentially. So we would just seek party protected protection, or excuse me, public protected confidentiality for the unaudited financials.
Okay. I'm going to reserve on that for the moment, and I'll speak with Dr. Gifford to make sure she's comfortable with that.
Sure.
But I want to make sure that I speak with her before I issue a ruling.
Thank you.
And then Dr. Murphy also referenced how Nuvance performs an analysis about migration. So we were interested in receiving any documentation that would support an analysis about migration that has occurred. And my assumption is that based on earlier testimony, that would have to be provided in a confidential submission due to not being able to share it with.
Correct, and that would be party protected material then.
Okay, I believe we're comfortable with that.
Thank you.
So I hadn't anticipated going through the late files, but those are the late files. In terms of the open session, there may be additional late files that come out as part of the executive session. Do you have a preference of who we begin with? Or? Okay. So we are going to move into executive session for, I don't think there is any joint executive session. We're going to start with Nuvance party protected executive session. So the individuals who will be present for this executive session will be Commissioner Gifford, Attorney Jackson, me, the CON staff assigned to the application, and that is Annalise Viella and Nicole Tomchik, our paralegal over in the corner, who is Faye Fentis, the court reporter, and anyone that Northwell, anyone that Nuvance has determined to be present. So Attorney Jensen, who will be attending the executive session for the party protected material of Nuvance?
Thank you. For Nuvance, it'll be legal counsel from Robinson Cole, along with Dr. Murphy, Dan DeBarba, and Brian Wyatt.
Okay, thank you. So at this time, I'm going to ask everyone else other than those who we have identified to leave the room. And we will come get you very soon. We only have, I believe, 1 or 2 questions for them, so it won't be long. All right, so we are back in open session of the hearing in docket number 24-32717-CON regarding the proposed affiliation between Northwell and Nuvance. We just held an executive session. Dr. Gifford made no decisions during that executive session. It was for the sole purpose of receiving information on those subjects that we previously determined constitute confidential matters. There were also no late files that came out of that executive session. I did want to note for the record that we did have a few other individuals who weren't identified before the executive session who were in attendance for the executive session. That was Attorney Boyle, Attorney Duffy, and Mr. DeBarbara. So we are now going to go into a second executive session. This one will be for Northwell Health only. We have, so the same individuals who are present on OHS's behalf will be attending this next executive session as well. And the topics were previewed with Northwell's attorney off the record, so they have an understanding of who we're going to be seeking to speak with. So Attorney Volpe, who will be present for that executive session?
Everyone who's currently in Northwell will stay during the executive session.
Okay, so I'm not going to have you all go through your names right now, but I am going to ask that if you're in this room and you're affiliated with Northwell, you provide your names to the court reporter before you leave. So, okay. So with that, we're going to transition over into the executive session. And we do have final remarks towards the end that we're going to do. So don't go far. We'll be back in touch. Welcome back. We are back in the open session of the hearing in docket number 24-32717-CON regarding the proposed affiliation between Northwell and Nuvance. We just held a party protected executive session with only Northwell. Dr. Gifford made no decisions during the executive session. It was for the sole purpose of receiving information on subjects that were previously determined to constitute confidential matters. There were also no late files that were discussed. We already did the late files earlier. There were 4 of them. That will be issued as in a written order, likely tomorrow, actually likely Friday, because I believe Dr. Gifford will not be available tomorrow. So you can look for that on Friday. I did want to ask the attorneys, would it be helpful to go through those again at this time, or do you feel comfortable providing your assessment of how long it might take to provide
I
the?
think it would be helpful to go through them.
Okay. So the first one I have on my list is, so 3 of them are for Nuvance, 1 of them is for Northwell. The first one for Nuvance is a full table of organization that includes, among other things, any for-profit entities. The second one is the unaudited financial documents and the breakdown for losses between hospital and physician practices and New York versus Connecticut. And as I read that, Attorney Jensen, I just realized that we hadn't decided whether you'd be able to submit that as a confidential filing. So I will have to take a moment to address that with Dr. Gifford before we adjourn for the day. Number 3 is analysis of outmigration from Nuvance. And then turning our attention to Northwell, it would be a response to CI on the bottom of NH0102 regarding a similar statement with respect to the full organizational structure of Northwell. Okay. Okay. I'm pleased to announce that the unaudited financials and the analysis of outmigration can both be submitted confidentially.
Thank you.
So with all of that, how long would you like? Would 2 weeks work? Do you want
No,
less than that?
actually,
Okay.
we'd be able to have our comprehensive work chart too, before the end of the week. So
Okay.
maybe
And-
before you even issue your order.
And Attorney Jensen?
We'd ask for 2 weeks, but we would intend to get it to you as soon as we could.
Okay. So in the order, we will say 2 weeks, and then if you get it to us sooner, you get it to us sooner.
Of course.
I think that's all sort of the remaining housekeeping matters. Is everyone ready to proceed to final remarks?
We are, and Attorney Jensen's gonna be offering our final closing remarks, so we'll have to hear from one of us.
Okay. So we're actually going to start with Attorney Knag, though, on behalf of the limited interveners.
Well, as I promised, I'm going to be very brief because I think we've made our points previously in the opening statements and in the testimony. We're very pleased that Northwell made the commitments to us that are in the letter. We need those commitments to be incorporated into the order. And we very much hope that you'll do that. And with some type of, normally the order would have some type of enforcement mechanism, and we would want that. Mr. Jermak spoke to that a little bit. But, in this case, we feel, based on our outstanding discussion with Northwell and the interface we've had so far, that in all likelihood, we won't have to look at any enforcement provisions. If we have any problems, we're going to have a representative on the advisory board, and we can mention that. But I think that, I still would like to have that in there. So those are my closing remarks.
Thank you, Attorney Kanong. So we can turn to Attorney Jensen now.
Thank you. And there is a just slide presentation to go along with my comments that I think Jess is pulling up.
Okay.
So on behalf of both of the applicants, I do want to extend our sincere thanks to Commissioner Gifford, Attorney Chuka, Attorney Jackson, and the entire OHS staff for the tireless efforts in connection with reviewing this application, the thoroughness that this entire process has involved. We're very much appreciative of that. I also greatly appreciate the time of all the witnesses today and the support teams from the applicants who have contributed to demonstrating. We believe that this proposed affiliation is a win for all involved. So as the evidence today that we presented today showed, this affiliation is specifically tailored to the goals of this CON process and what it's designed to achieve, which include: 1, ensuring access to high quality health services; 2, facilitating healthcare market stability; and 3, promoting the cost-effective delivery of healthcare. And the best way to accomplish these goals in this situation is by preserving and enhancing the operations of Nuvance Health's Connecticut hospitals, which are vital resources in our communities. And as I'll discuss, consistent with those goals and with OHS's mission generally, the end result of this affiliation and this application is that essential community resources will be strengthened. The delivery of healthcare in the state will be fiscally stabilized. Patients will continue to enjoy the choice to receive high quality care in their communities. And last, that the diversity of healthcare providers in Connecticut available to those patients will have been protected and enhanced. I'm going to go through next the statutory criteria under 19A 639, which I know you know well. There's a lot of overlap in those, so I've consolidated some of them to try to keep this moving. I appreciate your time today. So the first one I wanted to touch on is the alignment with the objectives of the state plan. One of those objectives under the state plan is controlling healthcare costs. Now here, because there's a minimal geographic overlap in the services provided by the applicants, there is no increase in market power, which is something that was discussed today. Now, as a result, there would not be corresponding increases in prices or costs of care, consistent with the state plan. Next, a goal of the state plan is to protect the viability of healthcare delivery systems in this state. As we've shown through this affiliation, we would preserve and strengthen the essential facilities and services of Nuvance, which would then correspondingly ensure the financial stability of Connecticut's healthcare system. The next statutory criteria I wanted to address, which is a combination of a couple different ones, but is the clear public need for the services. And I know Commissioner Gifford, you raised this in your introductory comments, along with the identification of the population to be served by those services. Now here, it's clearly and well established through this record that there's a significant public need for the services provided by Nuvance Health's Connecticut hospitals. Both the witnesses talked about that today, as well as many of the public commenters. And the target of those services is, of course, the individuals residing in those service areas of the Connecticut hospitals of Nuvance Health. These are vital resources in their communities, and this affiliation would strengthen and stabilize their operation going forward. The next statutory criteria is financial strength of the healthcare system in the state. We've heard from Northwell that there's been a commitment of a $1 billion capital investment by Northwell Health in Nuvance Health to preserve and enhance essential services in our local communities. Now, I want for a moment to consider what the alternative is, which would be the risk that Nuvance Health's hospitals were to become distressed and that service reductions would become necessary or even more severe options. That's what we're trying to avoid by pursuing this option. The next statutory factor looks to it's a combination of quality, accessibility, and cost effectiveness of healthcare delivery. Starting with quality first, here we're talking about an affiliation of two organizations with exceptional quality of care records. That hasn't been something that was a real focal point of today's proceeding, but there certainly has been a lot of information in the record about the quality records of these two organizations, which is exemplary. Next, there is Northwell's history of quality improvements with their other affiliated hospitals that they've acquired over time or affiliated with over time. And finally, another key point of this affiliation is the implementation of the EPIC electronic health record system, which will improve coordination of care, patient outcomes, and efficiency across Nuvance Health. Next, looking at accessibility of care. The affiliation in this circumstance would sustain access to essential services in the local communities and hopefully reverse some of the outmigration that we've seen historically, which then, because both Nuvance Health and Northwell Health are both mission-driven, not-for-profit organizations committed to providing care regardless of patients' ability to pay, access to care is improved in our communities. Next, cost effectiveness. The goal here, and clearly stated part of the application, is to promote participation in value-based care and shared savings programs, helping to drive down costs. And most importantly, is that patients will have the option to receive high-quality care delivered efficiently close to their homes. Next statutory criteria looks at payer mix and access to services by Medicaid recipients, something that's clearly a focal point, again, of this affiliation. Which will allow Northwell Health to enhance community health initiatives focused on health equity for vulnerable and at-risk populations. And both hospital systems have clearly demonstrated a shared commitment to the Medicaid program, and that will continue going forward. Next statutory criteria looks at utilization of existing healthcare facilities in the service area, avoidance of duplication, and diversity of healthcare providers and patient choice. Again, this affiliation preserves and strengthens existing Nuvance Health Connecticut hospitals and ambulatory locations. It is not designed to and will not have the effect of shifting volume away from existing providers, but instead will keep care local. Specific to, and this was raised again, Commissioner Gifford, during your introductory remarks about the statutory factors that are specific to hospital transfers or transfers of ownership of hospitals. There is the requirement of consideration of alternative proposals or consideration of alternatives. The affiliation, prior to engaging and deciding to partner with Northwell Health, Nuvance Health has provided detailed information about the alternatives that were considered: reducing or consolidating services, deferrals of projects and maintenance, as well as assessment of alternate potential partners. And that was all part of a process, that assessment of alternate partners, designed to ensure that any partner that ultimately was selected met Nuvance Health's board's criteria for compatibility with Nuvance Health's mission and with the financial capability, and that it had the financial capability to achieve the goals of the intended transaction. And the ultimate result of this deliberate process was that Nuvance Health was able to identify a partner that shared its values and its commitment to community hospitals. The next and final statutory factor that I'll address is the demonstration of the post-affiliation plans for providing care. Here, as Northwell has confirmed, there is no planned consolidation, reduction, or elimination of new services in the first 3 fiscal years. Next, as made clear in the record, there's an agreement of assurances that's been entered into representing commitments that have been made by Nuvance Health and by Northwell with the Connecticut and New York Attorneys General. And then finally, there was a lot of discussion today about commitments that were made by Northwell Health to Save Sharon Hospital and relating to Sharon Hospital. And those commitments are really commitments. I would just want to emphasize that evidenced by the numerous commenters speaking on behalf of this application today, those efforts by Northwell Health would be in furtherance of efforts over the past decades by Nuvance Health and its predecessors to provide essential care at Sharon Hospital. So in conclusion, I do want to emphasize a few key points from our application. First, the Connecticut hospitals operated by Nuvance Health are essential community resources. Faced with severe financial challenges, the leadership at Nuvance Health options and identified the course of action that most responsibly and effectively preserves and strengthens the ability of these hospitals to continue providing high quality care in our communities in Connecticut well into the future. Northwell Health shares Nuvance Health's focus on community health and has a proven track record of strengthening its hospital partners. By approving this application, Northwell Health and Nuvance Health can get to work investing in preserving and improving access to high quality care in our communities. This is a win for Northwell Health and Nuvance Health, who will integrate their operations in order to further their like-minded missions of improving the health of patients in our communities. This is a win for the state of Connecticut and the fiscal stability of the healthcare system in this state. And finally, this is a win for patients who will have the choice to receive local care protected. Thank you again for your time and efforts in connection with this application, and we respectfully ask that OHS approve this affiliation. Thank you.
Thank you, Attorney Jensen. I believe that brings this hearing to a close. So thank you all for attending today. Dr. Gifford, I don't know if you had any closing remarks you'd like to make.
No, just, yes, to say thanks to all of you for traveling and for the obvious amount of work and diligence that was put into the application. Thanks to our team at OHS, who is carrying around all the binders and doing the work in the background. And we look forward to continued conversations. Thank you.
So, sorry, one quick reminder. Written public comment can be submitted for up to 7 calendar days from today. So this hearing is hereby adjourned and the record will remain open until closed by OHS after receipt of the late files. So thank you very much.